ಓಪನ್ ಹಾರ್ಟ್ ವಿತ್ ಸಭಾದಲ್ಲಿ ಓಪನ್ ಹಾರ್ಟೆಡ್ಲಿ ಹೆಲ್ತ್ ಬಗ್ಗೆ ಮಾತಾಡ್ತಾ ಇದ್ದೀನಿ.
ಸ್ಪೆಸಿಫಿಕ್ಲಿ ನಾವು ಈಗ ವರ್ಲ್ಡ್ ಹೆಪಟೈಟಿಸ್ ಡೇ ಬರ್ತಾ ಇದೆ, ದಟ್ ಇಸ್ ಫಾರ್ ವೈರಲ್ ಹೆಪಟೈಟಿಸ್.
ಬಟ್ ಹೆಪಟೈಟಿಸ್ ಅಂತ ಬರೋದಾದ್ರೆ ಹೆಪಟೈಟಿಸ್ನ ಒಬ್ಬ ಹ್ಯೂಮನ್ ಬೇಯಿಂಗ್ ಎಷ್ಟು ಸೀರಿಯಸ್ ಆಗಿ ತಗೋಬೇಕು?
ಇದರಲ್ಲಿ 95% ವಿಲ್ ಹ್ಯಾವ್ ಅ ಫುಲ್ ರಿಕವರಿ. ಓಕೆ ರೈಟ್, ಅಕ್ಯೂಟ್ ಹೆಪಟೈಟಿಸ್ ಅಲ್ಲಿ the 5% will have serious complications. ಏನು serious complication? It can go for liver failure.
ಸ್ಲಮ್ ಏರಿಯಾಸ್, ಸೊ ತುಂಬಾ ಕಡೆ ಅವರು ಕಾವೇರಿ ವಾಟರ್ ಕುಡಿತಾರೆ ಅಥವಾ ಸಿಕ್ಕಿದ ನೀರು ಸಿಕ್ಕರೆ ಸಾಕು ಅನ್ನೋ ತರ ಇರುತ್ತೆ. ಸೊ ಆ ನೀರು ಟೆಸ್ಟ್ ಆಗಿದೆಯೋ ಇಲ್ವೋ ಅನ್ನೋದು ಗೊತ್ತಾಗೋದಿಲ್ಲ. ಸೊ ಅಂಥವ್ರು ಏನ್ ಮಾಡಬೇಕು?
Uncooked food source, which is the most commonly one which we forget about, is chutney.
2025 ಏಪ್ರಿಲ್ ತಿಂಗಳಲ್ಲಿ ಕೇರಳದಲ್ಲಿ 3277 ಕೇಸಸ್ ಆಗುತ್ತೆ ಹೆಪಟೈಟಿಸ್ ಬಿ. ಅದರಲ್ಲಿ 16 ಡೆತ್ ಆಗುತ್ತೆ. ಏನನ್ಸುತ್ತೆ, ಯಾವ ಕಾರಣಕ್ಕಾಗಿರ್ಬೋದು?
ಸೊ ನಾವು ಹೇಳ್ತೀವಿ ಇದಕ್ಕೆ ಹೆಪಟೈಟಿಸ್ ಅಂತ ಹೇಳ್ತೀವಿ, ಬಟ್ ಕಾಮನ್ಲಿ ವೆನ್ ವಿ ರೆಫರ್ ಟು ವೈರಲ್ ಹೆಪಟೈಟಿಸ್ ವಿ ಡು ನಾಟ್ ಇನ್ಕ್ಲೂಡ್ ಡೆಂಗು ಆರ್ ಮಲೇರಿಯಾ.
ಚಿಕನ್ ತಿಂದ್ರೆ ಫ್ಯಾಟಿ ಲಿವರ್ ಆಗ್ಬಿಡುತ್ತಾ ಅನ್ನೋ ಮಿತ್ ಇದೆ, ಇದ್ರ ಬಗ್ಗೆ ಏನು ಹೇಳ್ತೀರಿ?
ಅಬ್ಸಲ್ಯೂಟ್ಲಿ ಫಾಲ್ಸ್.
ಸೊ ಈ ಮಿತ್ ಕೇಳಿ ನಿಮಗೆ ನಗು ಬಂದಿದ್ಯಾ? ಹೌದು,
ಎಸ್ಪೆಷಲಿ ಇನ್ ದ ಫ್ಯಾಮಿಲಿ. ಅವ್ರಿಗೆ ಸೆಪರೇಟ್ ರೂಮ್ ಬೇಕಾ, ಸೆಪರೇಟ್ ಬಾತ್ರೂಮ್ ಬೇಕಾ, ಸೆಪರೇಟ್ ಇದು ಬೇಕಾ ಅಂತ. It is not true.
Okay,
right?
okay.
That is absolutely not required.
ಲಿವರ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ಸ್ ಯಾವ ಏಜ್ ಇಂದ ಯಾವ ಏಜ್ ವರೆಗೂ ಮಾಡಬಹುದು?
But any age can undergo liver transplant.
ಡಾಕ್ಟರ್ ಕೆಲಸ ಎಷ್ಟು ಕಷ್ಟ.
ಈಗ ವರ್ಕ್ ಫ್ರಮ್ ಹೋಮ್ ಮಾಡೋಕ್ಕಾಗಲ್ಲ ನನಗೆ, ರೈಟ್? ಐ ಹ್ಯಾವ್ ಟು ಬಿ ದೇರ್, ಐ ಹ್ಯಾವ್ ಟು ಸಿ ದ ಪೇಷಂಟ್.
ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ಓಪನ್ ಹಾರ್ಟ್ ವಿತ್ ಸಭಾ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಪ್ರೀತಿಯ ಸ್ವಾಗತ. ನನ್ನ ಈ ಕಾರ್ಯಕ್ರಮದ ಮೂಲಕ ನಗಬಹುದು, ಸಂಭ್ರಮಿಸಬಹುದು, ಅಳಬಹುದು, ಭಾವುಕರಾಗಬಹುದು, ನಿಮ್ಮ ಎಲ್ಲ ಭಾವನೆಯನ್ನು ಮುಕ್ತವಾಗಿ ವ್ಯಕ್ತಪಡಿಸಬಹುದು. ನಿಮ್ಮ ಅಂತ ಅಂದರೆ ನನ್ನ ಜೊತೆ ಈ ಪಾಡ್ಕಾಸ್ಟ್ನಲ್ಲಿ ಭಾಗಿಯಾಗುವಂತಹ ಗೆಸ್ಟ್, ಅದೇ ರೀತಿಯಾಗಿ ಆ್ಯಂಡ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ಲಿ ಈ ಕಾರ್ಯಕ್ರಮದ ಮೂಲಕ ನೋಡ್ತಾ ಇರುವಂತಹ ವ್ಯೂವರ್ಸ್ ಲೈಫಲ್ಲಿ ಒಂದು ಸಣ್ಣ ಸ್ಪಾರ್ಕ್ ಮೂಡಿದ್ರು ಅಥವಾ ಅವರ ಲೈಫಲ್ಲಿ ಒಂದು ಸಣ್ಣ ಚೇಂಜಸ್ ಆದರೂ ನಾನು ಈ ಕಾರ್ಯಕ್ರಮ ಮಾಡ್ತಿರೋದಕ್ಕೂ ಸಾರ್ಥಕ ಅಂತ ಅನಿಸುತ್ತೆ. ಸೊ ಹಾಗಾಗಿ ನಾನು ಇವತ್ತು ಸೆಲೆಕ್ಟ್ ಮಾಡಿಕೊಂಡಿರುವಂತಹ ವಿಷಯ ಡಾಕ್ಟರ್ ಪ್ಲಸ್ ಲಿವರ್. ವರ್ಲ್ಡ್ ಹೆಪಟೈಟಿಸ್ ಡೇನ ನಾವು ಸೆಲೆಬ್ರೇಟ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಸೊ ಈ ಸಂದರ್ಭದಲ್ಲಿ ಡಾಕ್ಟರ್ ಹರ್ಷವರ್ಧನ್ ರಾವ್ ಬಿ ನನ್ನ ಇವತ್ತಿನ ಪಾಡ್ಕಾಸ್ಟ್ನ ಓಪನ್ ಹಾರ್ಟ್ ವಿತ್ ಸಭಾನ ಗೆಸ್ಟ್ ಆಗಿದ್ದಾರೆ. HOD and ಕನ್ಸಲ್ಟೆಂಟ್, ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಮೆಡಿಕಲ್ ಗ್ಯಾಸ್ಟ್ರೋಎಂಟ್ರಾಲಜಿ, ರಾಮಯ್ಯ ಮೆಮೋರಿಯಲ್ ಹಾಸ್ಪಿಟಲ್. ಸೊ ಅವರು ಡಾಕ್ಟರ್ ಪ್ಲಸ್ ಲಿವರ್ಗಿರುವಂತಹ ಸಂಬಂಧ ಹೇಗೆ ಅಂತ ವಿವರಿಸ್ತಾರೆ. ಅವ್ರನ್ನ ವೆಲ್ಕಮ್ ಮಾಡೋಣ. ಡಾಕ್ಟರ್ ನಮಸ್ತೆ, ವೆಲ್ಕಮ್ ಟು ದ ಶೋ.
Thank you so much. Thank you.
How are you?
I'm good.
Actually, ಡಾಕ್ಟರ್ಗೆ how are you ಅಂತ ಕೇಳೋರು ತುಂಬ ಕಮ್ಮಿ ಅನ್ಸುತ್ತಲ್ಲ?
That is actually true. Yes.
Very nice. ಓಪನ್ ಹಾರ್ಟ್ ವಿತ್ ಸಭಾದಲ್ಲಿ ಓಪನ್ ಹಾರ್ಟೆಡ್ಲಿ ಹೆಲ್ತ್ ಬಗ್ಗೆ ಮಾತಾಡ್ತಾ ಇದ್ದೀನಿ. ಆ್ಯಂಡ್ ಅಫ್ಕೋರ್ಸ್ ಐ ಸೆಲೆಕ್ಟೆಡ್ ದ ಟಾಪಿಕ್. ಇಟ್ ಈಸ್ ಹೆಪಟೈಟಿಸ್. ಇಟ್ಸ್ ಅಬೌಟ್ ಹೆಪಟೈಟಿಸ್. ಅದ್ರ ಜೊತೆಗೆ ಹೆಪಟೈಟಿಸಲ್ಲಿ ಎಷ್ಟೆಲ್ಲ ಟೈಪ್ಸ್ ಬರುತ್ತೆ, ಸೊ ಅದು ಯಾವ ರೀತಿಯಾಗಿ ವರ್ಕ್ ಆಗುತ್ತೆ, ಅದರ ಸಿಮ್ಟಮ್ಸ್ ಹೇಗಿರುತ್ತೆ, ಅದನ್ನು ಡಯಾಗ್ನೋಸ್ ಮಾಡೋದು ಹೇಗೂ, ಇದೆಲ್ಲದರ ಬಗ್ಗೆ ಇನ್ಫಾರ್ಮೇಷನ್ನ ಕೊಡ್ತಾ ಹೋಗ್ತೀನಿ. ಅದರ ಜೊತೆಗೆ ಇದೇ 28 ವರ್ಲ್ಡ್ ಹೆಪಟೈಟಿಸ್ ಡೇನ ನಾವೆಲ್ಲರೂ ಸೆಲೆಬ್ರೇಟ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಮೋಟೋ ಏನು ಅಂತಂದರೆ 2030 ಅಷ್ಟೊತ್ತಲ್ಲಿ ಜಗತ್ತಲ್ಲಿ ಹೆಪಟೈಟಿಸ್ ಅನ್ನುವಂತಹ ಕಾಯಿಲೆ ಇರಬಾರ್ದು, ಅದನ್ನು ಅಷ್ಟು ಕಂಟ್ರೋಲ್ ಮಾಡಬೇಕು ಅನ್ನುವಂಥದ್ದು ವರ್ಲ್ಡ್ ಹೆಲ್ತ್ ಆರ್ಗನೈಸೇಷನ್ ಒಂದು ದೃಢ ನಿರ್ಧಾರ ತಗೊಂಡಿದೆ. ಲೆಟ್ಸ್ ಸಿ ಅದಕ್ಕೆ ಯಾವ ರೀತಿಯಾಗಿ ಹೆಲ್ತ್ ಸೆಕ್ಟರ್ನಲ್ಲಿ ಕೆಲಸ ಆಗ್ತಿದೆ ಅಂತ ತಿಳಿಸ್ಕೊಡೋದಕ್ಕೆ ನನ್ನ ಜೊತೆಗೆ ಡಾಕ್ಟರ್ ಹರ್ಷವರ್ಧನ್ ರಾವ್ ಇದ್ದಾರೆ. ಡಾಕ್ಟರ್, ಸೊ ವಿ ಆರ್ ಟಾಕಿಂಗ್ ಅಬೌಟ್ ಹೆಪಟೈಟಿಸ್. ಆ್ಯಕ್ಚುಲಿ ಹೆಪಟೈಟಿಸ್ ಅಂದರೆ ಏನು ಅನ್ನೋದ್ರ ಬಗ್ಗೆನೇ ತುಂಬ ಜನರಿಗೆ ಗೊಂದಲ. ವಾಟ್ ಇಟ್ ಈಸ್?
ಸೊ ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ಥ್ಯಾಂಕ್ ಯು ಫಾರ್ ಇನ್ವೈಟಿಂಗ್ ಮೀ ಸುಭಾ. ಹೆಪಟೈಟಿಸ್ ಅಂದರೆ ಜನರಲ್ ಟರ್ಮ್ ಹೆಪಟೈಟಿಸ್ ಹೇಳೋದು ಲಿವರ್ ಇನ್ಫ್ಲಮೇಷನ್ಗೆ. ಓಕೆ, ಲಿವರ್ ಏನಾದರೂ ಸ್ವೆಲ್ಲಿಂಗ್ ಆಗಿ ಲಿವರ್ಗೆ ಇನ್ಫ್ಲಮೇಷನ್ ಬಂದು ಅದಕ್ಕೆ ಹೆಪಟೈಟಿಸ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಸ್ಪೆಸಿಫಿಕ್ಲಿ ನಾವು ಈಗ ವರ್ಲ್ಡ್ ಹೆಪಟೈಟಿಸ್ ಡೇ ಬರ್ತಾ ಇದೆ, ದ್ಯಾಟ್ ಈಸ್ ಫಾರ್ ವೈರಲ್ ಹೆಪಟೈಟಿಸ್. ಓಕೆ, ವೈರಲ್ ಹೆಪಟೈಟಿಸ್ ಅಂದರೆ ಇಟ್ ಇಸ್ ದ ಹೆಪಟೈಟಿಸ್ ವಿಚ್ ಇಸ್ ಕಾಸ್ಡ್ ಬೈ ಸರ್ಟನ್ ವೈರಸಸ್. ಓಕೆ ರೈಟ್, hepatotropic virus ಅಂತ ಹೇಳೋದಿದು. These viruses specifically go and infect the liver.
Okay.
They live in the liver for some duration of time, depending upon the type of virus. Okay, right? And it can lead to health effects. Okay, right? So ಇದು specifically viral hepatitis ಹೇಳೋದು hepatitis A ಇಂದ E ಗೆ. Okay, commonly, right? 5 viruses irutte, right? But there are more types of viruses also, right, in this group. But commonly what we see is viral hepatitis A to E. So ಇದರಲ್ಲಿ ಯಾವುದಾದ್ರೂ ವೈರಸ್ಸು ಲಿವರ್ಗೆ ಇನ್ಫೆಕ್ಟ್ ಆಗಿ ಅದರಿಂದ ಕಾಯಿಲೆ ಬಂದಿದ್ರೆ ವಿ ಕಾಲ್ ಇಟ್ ವೈರಲ್ ಹೆಪಟೈಟಿಸ್, ರೈಟ್?
ನಮಗೆ ಆ್ಯಕ್ಚುಲಿ ಬೇರೆ ಕಾಯಿಲೆಗಳು ಬಂದಾಗ, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಡಯಾಬಿಟೀಸ್ ಆದಾಗ ಅಥವಾ ಹಾರ್ಟ್ ರಿಲೇಟೆಡ್ ಏನಾದರೂ ಇಶ್ಯೂ ಇದ್ದಾಗ, ಬಿ ಪಿ ಇದ್ದಾಗ, ಸೊ ಇದನ್ನು ತುಂಬ ಸೀರಿಯಸ್ ಆಗಿ ತಗೊಳ್ತಾರೆ. ವೆನ್ ಇಟ್ ಕಮ್ಸ್ ಟು ಲಿವರ್, ಸೊ ಜನ ಅದನ್ನು ತಗೊಳ್ಳೋದು ತುಂಬ ಲೈಟ್ಲಿ ತಗೊಳ್ತಾರೆ. ಹೌ ಇಂಪಾರ್ಟೆಂಟ್ ಲಿವರ್ ಫಾರ್ ಅಸ್, ಫಾರ್ ಹ್ಯೂಮನ್?
ಐ ಥಿಂಕ್ ದೆರ್ ಇಸ್ ಅ ರೀಸನ್ ಫಾರ್ ದಿಸ್, ಓಕೆ, ರೈಟ್? ಯಾಕಂದರೆ ಇದು ಲಿವರ್ ಈಸ್ ಆರ್ ಫಸ್ಟ್ ಲೈನ್ ಆಫ್ ಡಿಫೆನ್ಸ್, ಓಕೆ, ರೈಟ್? ನಾವು ಏನಾದರೂ ತೊಗೊಂಡ್ರೆ, ರೈಟ್, ಮೆಡಿಸಿನ್ಸಾ, ಫುಡ್ಡಾ, ಏನಾದರೂ ಲಿಕ್ವಿಡ್ಸ್ ತೊಗೊಂಡ್ರೆ, ರೈಟ್, ಅದೆಲ್ಲ ಫಸ್ಟ್ ಲಿವರ್ಗೆ ಹೋಗಿ ಫಿಲ್ಟರ್ ಆಗಿ ದೆನ್ ದ ಲಿವರ್ ಕ್ಯಾನ್ ಡಿಸೈಡ್ ವೆದರ್ ಇಟ್ ಶುಡ್ ಬಿ ಸ್ಪ್ರೆಡ್ ಇನ್ ದ ಬಾಡಿ ಆರ್ ಇಟ್ ಶುಡ್ ಬಿ ರಿಮೂವ್ಡ್ ಫ್ರಮ್ ದ ಬಾಡಿ, ಓಕೆ, ರೈಟ್? ಸೊ ಇದ್ದಾಗ ಇನ್ ಲಿವರ್ ಇಸ್, ಐ ಥಿಂಕ್, ಒನ್ ಆಫ್ ದ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಆರ್ಗನ್ಸ್ ಇನ್ ದ ಬಾಡಿ, ರೈಟ್? ಬಟ್ the human body is so beautifully designed that liver has the maximum capacity to tolerate damage, right? ನಮಗೆ ಸ್ಟ್ರಿಕ್ಟ್ ಆಗಿ ನೋಡಬೇಕಂದ್ರೆ we require only 30% of the liver functioning for us to be normal, right? That means liver over the period of time, over our life, liver ಸ್ವಲ್ಪ ಡ್ಯಾಮೇಜ್ ಆಗ್ತಾ ಹೋಗ್ಬೋದು, right? But it will not cause any disturbance in the body physiology, okay, right? That is because the liver can tolerate damage, right? So that is what it is built. The human body is built in such a way where redundancy anta heltivi. Redundancy andre even if one component work ಆಗ್ತಾ ಇಲ್ಲ ಅಂದ್ರೆ there will be an alternate component which comes and takes its place. That is very high in liver, right? So ಅದಕ್ಕೆ we take this lightly because even if there is some amount of liver damage ಇದ್ರೇನು, right, ಅದರಿಂದ ಏನು ಹೆಲ್ತ್ ಎಫೆಕ್ಟ್ಸ್ ಏನು ಬರಲ್ಲ, ಈ ಸಿಂಪ್ಟಮ್ಸ್ ಏನು ಇರಲ್ಲ, ಯುವರ್ ಕ್ವಾಲಿಟಿ ಆಫ್ ಲೈಫ್ ಇಸ್ ಮೇಂಟೈನ್ಡ್, ರೈಟ್? ಸೊ ದಟ್ಸ್ ವೈ ವಿ ಡೋಂಟ್ ಟೇಕ್ ಇಟ್ ವೆರಿ ಸೀರಿಯಸ್ಲಿ. ಹಾರ್ಟಿಗೆ ಒಂದ್ಸಲ there is a problem, you are pretty much crippled, right? Brain has zero capacity for regeneration. In fact, over your lifetime, brain only degenerates, and that degeneration will start from the age of 30, believe it or not, okay, right? From the age of 30, your neural capacity is on the decline very slowly. It does not cause any you won't realize it, right? But the period of maximum growth of the brain is in the younger age, childhood age and teenage years. Adadmele it slowly starts reducing, right? But liver is the opposite. Liver starts functioning more as we grow up more, right? The liver is smaller, it starts expanding, right? And over a period of time the liver capacity also is much higher, right? As long as we don't abuse it, right? So adrinda liver diseases so far, even though we say, because I'm sure nimgenu experience agide or someone you know where they have had some hepatitis, right? Adre immediately after that they are totally normal. In fact, diet is normal irutte, ಏನು ಇರಲ್ಲ, right? That's because the liver has the regenerative capacity, right? So adrinda maybe the perception is that liver may not be a vital organ.
Actually ನೀವು ಇಷ್ಟೆಲ್ಲ ಹೇಳ್ದಾಗಿಂದ ನನಗೇನು ಅನಿಸ್ತು ಅಂತಂದರೆ, ನಮ್ಮ ಬಾಡಿಲಿರೋ ಪ್ರತಿಯೊಂದು ಆರ್ಗನ್ ತುಂಬ ಇಂಪಾರ್ಟೆಂಟ್, ಅದರಲ್ಲೂ ಲಿವರ್ ಅನ್ನೋದು ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್. ಲಿವರ್ ತನಗೆ ಆಗ್ತಿರೋ ಮಿಸ್ಟೇಕ್ಸ್ ಅಥವಾ ತನಗೆ ಏನಾದರೂ ಎಫೆಕ್ಟ್ ಆಗ್ತಾ ಇದೆ, ಅದನ್ನು ಹೇಗೆ ಸರಿ ಮಾಡ್ಕೋಬಹುದು, ಹೇಗೆ ಫಂಕ್ಷನ್ ಆಗ್ಬೋದು ಅನ್ನೋದನ್ನು ಅದು ತಂತಾನೇ ಸರಿ ಮಾಡ್ಕೊಂಡು ಬರುತ್ತೆ. ಪೀಕಿಗೆ ಹೋದಾಗ ಇಟ್ ವಿಲ್ ಥ್ರೋ ಔಟ್.
ಎಕ್ಸಾಕ್ಟ್ಲಿ.
ಆ್ಯಂಡ್ ದ ಥಿಂಗ್ ಈಸ್, ಆ್ಯಕ್ಚುಲಿ ಲಿವರ್ನ ತುಂಬ ಸ್ಲೈಟ್ಲಿ ತಗೊಳ್ತಾರೆ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ನಾವು ಮಾತಾಡಿದಾಯಿತು. ಬಟ್ ಹ್ಯಾಪಟೈಟಿಸ್ ಅಂತ ಬರೋದಾದರೆ ಹ್ಯಾಪಟೈಟಿಸ್ನ ಒಬ್ಬ ಹ್ಯೂಮನ್ ಬೀಯಿಂಗ್ ಎಷ್ಟು ಸೀರಿಯಸ್ ಆಗಿ ತಗೋಬೇಕು?
ಸೊ ಹೆಪಟೈಟಿಸ್ ಇಸ್ ಟೂ ಮೇನ್ ಟೈಪ್ಸ್, ಅಂದರೆ ನಾಟ್ ಜಸ್ಟ್ ವೈರಸ್ ಪ್ರಕಾರ ಅಲ್ಲ. ಇಫ್ ವಿ ಲುಕ್ ಅಟ್ ಕ್ಲಿನಿಕ್ಲಿ, ರೈಟ್, ಇದು ಅಕ್ಯೂಟ್ ಹೆಪಟೈಟಿಸ್ ಅಂತ ಬರುತ್ತೆ ಮತ್ತು ಕ್ರಾನಿಕ್ ಹೆಪಟೈಟಿಸ್ ಅಂತ ಬರುತ್ತೆ. ಅಕ್ಯೂಟ್ ಹೆಪಟೈಟಿಸ್ ಅಂದರೆ ದ ಡಿಸೀಸ್ ಡೆವಲಪ್ಸ್ ಓವರ್ ಅ ಪೀರಿಯಡ್ ಆಫ್ ಫ್ಯೂ ಡೇಸ್ ಟು ಮಂತ್ಸ್, ಓಕೆ, ರೈಟ್? ಕ್ರಾನಿಕ್ ಹೆಪಟೈಟಿಸ್ ಅಂದರೆ ಎನಿ ಹೆಪಟೈಟಿಸ್ ವಿಚ್ ಇಸ್ ಪರ್ಸಿಸ್ಟಿಂಗ್ ಬಿಯಾಂಡ್ 6 months, right? We call it chronic hepatitis, okay, right? So ಇದರಲ್ಲಿ this is a distinction to be made when you have to see how seriously the disease is. Acute hepatitis andre it is caused by hepatitis A, B and E.
Till E.
C doesn't cause too much acute hepatitis, okay, right? Acute hepatitis is mainly these three. Idralli 95% will have a full recovery, okay, right? Acute hepatitis alli The 5% will have serious complications. ಏನು serious complication? It can go for liver failure. Okay, right? Adre, it's rare, but when it happens, it is very serious. Okay, right? Chronic hepatitis andre over a period of time slowly damage ಆಗ್ತಾ ಹೋಗುತ್ತೆ. Right? If you intervene at that point, it is very easy to stop that progression. Okay, right? ಆದರೆ if we don't take it seriously, ಅದು cirrhosis ಅಂತ ಆಗ್ಬೋದು. And cirrhosis ಅಂದರೆ liver functioning has come down to a significant level. Okay, less than 30%. Right? And then ಇದರಿಂದ next stage ಅಂದರೆ liver cancer. Right? Okay. So the message is early intervention for chronic hepatitis, right? Acute hepatitis alli be watchful for complication, and complication irvaga early treatment ಮಾಡಬೇಕು, right? But by and large 95% of patients with acute hepatitis will make a full recovery.
Okay. Sir, actually ಕೆಲವೊಂದು ಹೆಪಟೈಟಿಸ್ ನಮಗೆ ಆದಾಗ ನಮ್ಗೆ ಹೆಪಟೈಟಿಸ್ ಆಗಿದೆ ಅಂತಾನೆ ಗೊತ್ತಾಗೋದಿಲ್ಲ, ಅಂತಾನೆ ರಿಕವರಿ ಕೂಡ ಆಗೋಗಿರುತ್ತೆ, ಅಥವಾ ಲಾಸ್ಟ್ ಸ್ಟೇಜಲ್ಲಿ ಗೊತ್ತಾಗುತ್ತೆ ಹೆಪಟೈಟಿಸ್ ಆಗಿತ್ತು ಅಂತ ಅಂದು. ಅದ್ರ ಬಗ್ಗೆ ಡೆಫಿನೆಟ್ಲಿ ಐ ವಾಂಟ್ ಆಸ್ಕ್ ಯು, ಬಟ್ ಬಿಫೋರ್ ದಟ್ ಐಲ್ ಆಸ್ಕ್ ಅಬೌಟ್ ಸಮ್ ಎಕ್ಸಾಂಪಲ್ಸ್. ಲೈಕ್ ರೀಸೆಂಟ್ಲಿ ವಾಟ್ ಹ್ಯಾಪನ್ ಇನ್ ಪುಣೆ, ದಿಸ್ ಇಸ್ ರೈನಿ ಸೀಸನ್, ಸೊ ವೈರಲ್ ತರ ಅದು ಸ್ಪ್ರೆಡ್ ಆಗ್ತಾ ಇದೆ. ಏನ್ ಹೇಳ್ತೀರಿ ಇದ್ರ ಬಗ್ಗೆ?
So it is a common finding actually, that hepatitis A especially, right? Yakandre hepatitis A spreads in infected food and water, contaminated food and water. So one common source irvaga of water, right? And that common source gets infected or contaminated, right? Tumba janage cluster ಆಗುತ್ತೆ infection, right? So ಆ clusters irvaga it becomes a major public health concern. Okay, right? ಇದು ರೀಸೆಂಟ್ ಆಗಿರೋದು ಪುಣೆದಲ್ಲಿ. ಇಟ್ಸ್ ನಾಟ್ ಅನ್ ಐಸೋಲೇಟೆಡ್ ಇನ್ಸಿಡೆಂಟ್. ಓಕೆ, ರೈಟ್? ಇಟ್ ಈಸ್ ಸಮಥಿಂಗ್ ದಟ್ ವಿ ಡೀಲ್ ವಿತ್ ಆನ್ ಅ ರೆಗ್ಯುಲರ್ ಬೇಸಿಸ್. ಇಟ್ ಜಸ್ಟ್ ಇನ್ ಪುಣೆದಲ್ಲಿ ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ನಂಬರ್ಸ್ ಇದೆ. ಬಟ್ ಟು ಗಿವ್ ಯು ಅನ್ ಎಕ್ಸಾಂಪಲ್, ನಾನು MBBS ಮಾಡುವಾಗಲೇ, ರೈಟ್, ನನ್ನ ಹಾಸ್ಟೆಲಲ್ಲೇ, ರೈಟ್, ದೇರ್ ವಾಸ್ ಅ ಔಟ್ಬ್ರೇಕ್. Okay, right? ನನಗೂ ಹೆಪಟೈಟಿಸ್ A ಆಗಿತ್ತು, right? I was admitted, right? And a lot of students ಆಗಿತ್ತು because our water supply in the hostel was the one that was contaminated. Okay, right? So ಆ ಥರ we find that this is a regular occurrence. Okay, right? So ಈ ಥರ ಇರುವಾಗ public health perspective ನೋಡುವಾಗ we have to identify the contaminated source, right? And we have to treat that contaminated source. Prevention ನೋಡ್ಬೇಕಂದ್ರೆ all water should be treated before you consume it. Okay, right? But that is sometimes can be lacking, and that is when the outbreaks happen, right? So hepatitis A is fairly common, especially where there are common sources of water as well as common food sources.
Okay. Right? How important it is andre yavado ondu, for example sir, we are staying in Bengaluru, we have aqua athwa bere namge water source bere irutte. The people who are staying in ಸ್ಲಮ್ ಏರಿಯಾಸ್, ಸೊ ತುಂಬ ಕಡೆ ಅವರು ಕಾವೇರಿ ವಾಟರ್ ಕುಡಿತಾರೆ, ಅಥವಾ ಸಿಕ್ಕಿದ ನೀರು ಸಿಕ್ಕರೆ ಸಾಕು ಅನ್ನೋ ಥರ ಇರುತ್ತೆ. ಸೊ ಆ ನೀರು ಟೆಸ್ಟ್ ಆಗಿದೆಯೋ ಇಲ್ವೋ ಅನ್ನೋದು ಗೊತ್ತಾಗೋದಿಲ್ಲ. ಸೊ ಅಂಥವ್ರು ಏನು ಮಾಡಬೇಕು?
ಸಿ ದ ಥಿಂಗ್ ಇಸ್, ಇಟ್ ಇಸ್ ನಾಟ್ ಆ ಥರ ಕಾಮನ್ ಥರ ಅಲ್ಲ. ಓಕೆ, ರೈಟ್? ಅದು ನಮ್ಮದು ನಾರ್ಮಲ್ ಗ್ಯಾಸ್ಟ್ರೋಎಂಟರೈಟಿಸ್ ಆಗುತ್ತೆ. ಎಸ್, ಎಕ್ಸಾಕ್ಟ್ಲಿ, ರೈಟ್. Not all people also viral infection ಆದಮೇಲೆ ಅವ್ರಿಗೆ serious ನೀವು ಹೇಳಿದ್ದು, sometimes you will have some non-specific symptoms and it will pass off. Okay, right? Few people are the one who have this acute hepatitis syndrome that we call, right? Sources of water definitely needs to be looked into. Okay, right? Surprisingly, lower socioeconomic strataದಲ್ಲಿ we don't see many viral hepatitis. Okay, right? We see it during especially students who travel, okay, right? Or a professional who's traveling a lot and on the train ಏನಾದರೂ ತೊಗೊಂಡಿದ್ದಾರೆ, right? Those are the cases that we see very common these days. Apart from clusters, okay, right? So ಅದರಲ್ಲಿ usually it is the stalls on the street, right? ಅಲ್ಲಿ ಸ್ವಲ್ಪ ಕಂಟಾಮಿನೇಷನ್ ಇರೋದು more chances.
The best example is ಪುಣೆಲಿ ಸಿಕ್ಕಿರೋ ಚಟ್ನಿ ಎಕ್ಸ್ಚೇಂಜ್ ಆದಂಗೆ ಯಾರೆಲ್ಲ ತಗೊಂಡಿದ್ದಾರೆ ಅವರಲ್ಲಿ ಕಾಣಿಸ್ಕೊಂಡಿದೆ.
Yes. So as a general preventive measure, if you want to look at it, high risk individuals ಗೆ I always prescribe or advise them that uncooked food and water source ಸ್ವಲ್ಪ you have to take care. Okay, right? Uncooked food source, which is the most commonly one which we forget about, is chutney, right? Now idli sambar ಹೋಗ್ತೀವಿ, chutney ಇರುತ್ತಲ್ಲಿ. That chutney is kept out for a very long period, right? ಯಾರು ಹ್ಯಾಂಡಲ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ ಅಂತ ಗೊತ್ತಿಲ್ಲ, right? Because it comes from the person who's handling, right? ಏರಿಂದ ಬರಲ್ಲ, ಇಟ್ ಹ್ಯಾಸ್ ಟು ಕಮ್ ಫ್ರಮ್ ದ ಪರ್ಸನ್ ಹೂಸ್ ಹ್ಯಾಂಡ್ಲಿಂಗ್, ರೈಟ್? ಸೊ ಅದರಿಂದ ಯೂಶಲಿ ಬರೋದು ಸ್ಯಾಲಡ್ಸ್, ಚಟ್ನೀಸ್, ಫ್ರೂಟ್ ಜ್ಯೂಸಸ್, ಮಿಲ್ಕ್ ಶೇಕ್ಸ್, ರೈಟ್? ಇದೆಲ್ಲ ಯು ಹ್ಯಾವ್ ಟು ಬಿ ಕೇರ್ಫುಲ್ ಅಬೌಟ್ ದ ಸೋರ್ಸ್ of the food, right? And try and see how you can reduce it as much as possible.
When it comes to gut health, actually ivaga if it is about skin, if it is about any disease, doctor hatra hodaga improve your gut health anta ಹೇಳ್ತಾರೆ. For that ಫ್ರೆಶ್ ಜ್ಯೂಸ್ ಕುಡಿಬೇಕು ಅಂತ ಹೇಳ್ತಾರೆ, ಸ್ಯಾಲಡ್ಸ್ ತಿನ್ನಬೇಕು ಅಂತ ಹೇಳ್ತಾರೆ, ಮಜ್ಜಿಗೆ ಕುಡಿಬೇಕು ಅಂತ ಹೇಳ್ತಾರೆ. ಸೊ ಅಲ್ಲಿ ಏನಿರುತ್ತೆ ಅನ್ನೋದು ನಮಗೆ ಗೊತ್ತಿರಲ್ಲ. ಸೊ ಅಲ್ಲಿ ಹೆಪಟೈಟಿಸ್ ಬರದೇ ಇರೋ ಥರ ಹೇಗೆ ತಡಿಬೇಕು?
It's really when we say gut health, you're right in terms of now healthy amount of raw vegetables and
fiber
fruits,
content will
right? You have to increase, right? Fermented foods like curds, ಮಜ್ಜಿಗೆ ಅದೆಲ್ಲ ತಗೊಳ್ಳೋದು ಒಳ್ಳೆಯದು, ಓಕೆ, ರೈಟ್? ಬಟ್ ಅಟ್ ದ ಸೇಮ್ ಟೈಮ್ ನಾವು ಮನೇಲೇ ಏನು ಇದೆಲ್ಲ ಮಾಡ್ತಾ ಇದೀವಿ ಅಂದರೆ ದೇರ್ ಶುಡ್ ಬಿ ನೋ ಪ್ರಾಬ್ಲಮ್ ಬಿಕಾಸ್ ವಿ ವಾಶ್ ಅವರ್ ವೆಜಿಟಬಲ್ಸ್, ವಿ ವಾಶ್ ದ ಫ್ರೂಟ್ಸ್, ರೈಟ್? ದ ವಾಟರ್ ಸೋರ್ಸಸ್ ಪ್ಯೂರ್ ಆಕ್ವಾಗಾರ್ಡ್ ಇರುತ್ತೆ, ಪ್ಯೂರಿಫೈಯರ್ ಇರುತ್ತೆ, ರೈಟ್? ಹೊರಗಡೆ ಹೋಗುವಾಗ ಯು ಹ್ಯಾವ್ ಟು ಲುಕ್ ಎಟ್ ದೀಸ್ ಆಸ್ಪೆಕ್ಟ್ಸ್, ಓಕೆ, ರೈಟ್? ಸೊ ದೀಸ್ ಆಸ್ಪೆಕ್ಟ್ಸ್ ವಿಲ್ ಬಿ ಕೀ ಓನ್ಲಿ ವೆನ್ ಯು ಆರ್ ಲುಕಿಂಗ್ ಎಟ್ ನಾವು ಯಾಕೆ ಬರೋದು. ಈವನ್ ರೆಪ್ಯೂಟೆಡ್ ರೆಸ್ಟೋರೆಂಟ್ಸ್ ಆ್ಯಂಡ್ ಜಾಯಿಂಟ್ಸ್ ದೇ ಯೂಶಲಿ ಹ್ಯಾವ್ ಸಮ್ ಕ್ವಾಲಿಟಿ ಕಂಟ್ರೋಲ್, ರೈಟ್? ಕ್ವಾಲಿಟಿ ಕಂಟ್ರೋಲ್ ಎಲ್ಲಿರಲ್ಲ ವಿಲ್ ಬಿ ದ ಒನ್ಸ್ ವೇರ್ ಯು ಹ್ಯಾವ್ ದ roadside dosa angadis, right? Street food, right? These are the ones where quality control is not there. So only make sure that you are in a place where there is quality control, ashte, right? Beyond that you cannot, it's not 100% kind of like, prevention strategy, but it definitely helps for you to be vigilant. Nan prakara, if patients are just aware that this can happen, right? ಅವರೇ ಸ್ಟೆಪ್ಸ್ ತೊಗೊಳ್ತಾರೆ, ಸಬ್ಕಾನ್ಷಿಯಸ್ಲಿ ಬರುತ್ತದು, ರೈಟ್? ಸೊ ಅವೇರ್ನೆಸ್ ಇಸ್ ದ ಕೀ, ಐ ಥಿಂಕ್, ರೈಟ್? ಇನ್ ದ ಪ್ರಿವೆನ್ಷನ್ ಸ್ಟ್ರಾಟಜಿ. ಇದೆಲ್ಲ ನಾವು ಎಷ್ಟು ಕಂಟ್ರೋಲ್ ಮಾಡ್ಬೋದೋ ಮಾಡ್ತೀವಿ, ಬಟ್ ಪೇಷಂಟ್ ಅವೇರ್ನೆಸ್ ಇಸ್ ದ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಸ್ಟೆಪ್.
ಟ್ರೂ. ಪ್ರಿವೆನ್ಷನ್ ಈಸ್ ಬೆಟರ್ ದೆನ್ ಕ್ಯೂರ್ ಅಂತ ಹೇಳ್ತಾರೆ. ಸೊ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಫ್ರೂಟ್ಸ್ ಎಕ್ಸಾಂಪಲ್ ಕೊಡ್ತಾ ಇದ್ರಿ, ನೀವು ವೆಜಿಟೇಬಲ್ ಎಕ್ಸಾಂಪಲ್ ಕೊಡ್ತಾ ಇದ್ರಿ. ಸೊ ಮನೇಲಿ ನಾನೇ ಸ್ಯಾಲಡ್ ಪ್ರಿಪೇರ್ ಮಾಡ್ತೀನಿ ಸರ್. ಬಿಫೋರ್ ಪ್ರಿಪೇರಿಂಗ್ ಸ್ಯಾಲಡ್ ಐ ಜಸ್ಟ್ ವಾಶ್ ಇಟ್.
ಎಕ್ಸಾಕ್ಟ್ಲಿ.
ಬಟ್ ವಾಶ್ ಮಾಡೋದಕ್ಕೂ ಒಂದು ವಿಧಾನ ಇದೆಯಾ, ಅಥವಾ ಇದೇ ಥರ ವಾಶ್ ಮಾಡಬೇಕು, ಸಾಲ್ಟ್ ಹಾಕ್ಬಿಟ್ಟು ವಾಶ್ ಮಾಡಬೇಕು?
ನಾಟ್ ರಿಕ್ವೈರ್ಡ್. ಅದೆಲ್ಲ ಏನು, ಜಸ್ಟ್ ವಾಶ್ ಇಟ್ ಥರಲಿ, ರೈಟ್? ಯು ಡೋಂಟ್ ಹ್ಯಾವ್ ಟು ಯೂಸ್ ಎನಿ ಅದು ಸಾಲ್ಟ್ ಹಾಕೋದು ಆ್ಯಂಡ್ ಫ್ಯೂ ಥಿಂಗ್ಸ್ ದಟ್ ದೇ ಯೂಸ್ ಟು ಟ್ರೀಟ್ the fruits and vegetables are mainly for fertilizers, and if there is artificial wax ella haktare to make the fruits look shinier, right? So only in those situations. As per for the viral part of it, it is just washing is enough in water, right? The virus does not survive outside for more than a few seconds, okay, right? It needs to have that temperature for it to survive. So with water itself is enough.
Okay. 2025 ಏಪ್ರಿಲ್ ತಿಂಗಳಲ್ಲಿ ಕೇರಳದಲ್ಲಿ 3,277 ಕೇಸಸ್ ಆಗುತ್ತೆ ಹೆಪಟೈಟಿಸ್ ಬಿ. ಅದರಲ್ಲಿ 16 ಡೆತ್ ಆಗುತ್ತೆ. ಏನನ್ಸುತ್ತೆ, ಯಾವ ಕಾರಣಕ್ಕಾಗಿರ್ಬೋದು?
Hepatitis B, no, hepatitis B is a different virus, okay, right? Hepatitis B does not spread through food and water, okay? Hepatitis B spreads through body fluid transfer, okay, right? So unprotected sexual intercourse, right? Or use needles, right? Or blood transfusion which is not adequately screened, right? Or blades which are reused, okay, right? These are the ways where hepatitis B can spread, okay, right? And of course the other is from pregnant mother to child if the mother is hepatitis B positive during pregnancy, okay, right? So hepatitis B prevention is a different strategy completely. Hepatitis A and E is separate. Hepatitis B and C is separate. B and C itara spread agodu, right? And if you look at the numbers, yes, Kerala does have high numbers. In fact, I was in Kerala. I worked in Kerala for 10 years. Okay, right, before coming to Bangalore, right? And when we were there, we identified a cluster in a town called Patnamthitta. And this was possible areas. We did the study and we found possible areas is our blades shave ಮಾಡ್ತಾರಲ್ವಾ, right? ಆ blades reuse ಮಾಡ್ತಾ ಇದ್ರು. There was no concept of taking separate new blades or sterilizing the blade. ಆ ಥರ ಇರಲಿಲ್ಲ. One of the possible this one we thought was that. There were other things also, but why I'm highlighting that is it can be as innocuous that you won't even now namge we don't realize that these are the possible sources of infection,
chutney.
right? Ade chutney,
Yes.
right? And now shaving ಹೋಗ್ತೀವಿ, we don't know what the blade is,
Yeah.
right? And then 1 year later ನೀವು ಬ್ಲಡ್ ಟ್ರಾನ್ಸ್ಫ್ಯೂಷನ್ಗೆ ಸ್ಕ್ರೀನಿಂಗ್ ಮಾಡ್ತಾರೆ, ಹೆಪಟೈಟಿಸ್ ಬಿ ಅಂತ ಪಾಸಿಟಿವ್ ಬರುತ್ತೆ, ರೈಟ್? ಸೊ ದ್ಯಾಟ್ ಇಸ್ ದ ಪ್ರಾಬ್ಲಮ್, ರೈಟ್? ಹೆಪಟೈಟಿಸ್ ಬಿ ಅ ಲಾಟ್ ಆಫ್ ಕೇಸಸ್ ನಾವು ಈಗ maybe 20 years back we had a lot of cases of hepatitis C. ಈಗ ತುಂಬ ಕಡಿಮೆ ಆಗಿದೆ. The reason was it was coming in blood transfusion, right? So only after 90s early 2000s ಅಲ್ಲಿ ಯಾವುದು ಬ್ಲಡ್ ಟ್ರಾನ್ಸ್ಫ್ಯೂಷನ್ ಕೊಟ್ಟಿದ್ದಾರೋ, ರೈಟ್, a lot of them there was hepatitis C transmission, right? ಅದಾದಮೇಲೆ we started screening the blood, right? ಅದಾದಮೇಲೆ we see very little or very rarely we see hepatitis C in this part of the world, okay, right? It is still seen in Africa, it is still seen in parts of Asia, Southeast Asia, but in this part of the world, Western countries, hepatitis C is very, very rarely seen, right?
Okay.
Western countries are ಜಾಸ್ತಿ ಆಗ್ತಾ ಇದೆ ಈಗ because they are there's a lot more drug use now,
Yes.
right? That is seeing a huge comeback in the Western countries. So they do see hepatitis C now. There's a resurgence in a few parts of the Western world.
When we are talking about hepatitis B and C, tell me, hepatitis ಅಲ್ಲಿ 5 ಟೈಪ್ಸ್ ಇದೆ ಅಂತ ಹೇಳ್ತಾರೆ, ಟಿಲ್ 1 to E. ಅದರಲ್ಲಿ ಯಾವುದು ತುಂಬ ಡೇಂಜರಸ್ ಅಥವಾ ಯಾವುದು ನಾರ್ಮಲ್ ಅಂತ ನಾವು ಕನ್ಸಿಡರ್ ಮಾಡ್ಬೋದು?
See, hepatitis A and E is by and large self-limiting illness ಇದು, ಓಕೆ, ರೈಟ್? ಈಗ ಅಕ್ಯೂಟ್ ಹೆಪಟೈಟಿಸ್ ಎ ಬಂದರೆ, ರೈಟ್, ಆ್ಯಕ್ಚುಲಿ ಏನು ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡಲ್ಲ ನಾವು ಜಸ್ಟ್ ಸಪೋರ್ಟಿವ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡೋದು, ಓಕೆ, ರೈಟ್? ಆ್ಯಂಡ್ ಯು ವೇಟ್ ಫಾರ್ ದ ಬಾಡೀಸ್ ಇಮ್ಯುನಿಟಿ ಇಟ್ ಸೆಲ್ಫ್ ಟು ಕ್ಲಿಯರ್ ದ ವೈರಸ್, ವಿಚ್ ವಿಲ್ ಹ್ಯಾಪನ್ ಇನ್ 95% of cases, right? Only in the 5% of cases they'll require management, and that management is acute liver failure idre we have to go in for a liver transplant only, right? So it is two extremes, right? 95% will have a completely uneventful progression. 5% will have an extremely serious progression, right? Hepatitis E, especially in pregnancy, ಅವ್ರಿಗೆ hepatitis E ಬಂದಾಗ mother can have a liver failure, right? So that's something we need to guard against, okay, right? Hepatitis B and C is a long drawn disease, okay, right? ಬಂದರೆ ಒಂದ್ಸಲ hepatitis B to cure it is very, very unlikely. Okay, right? So once sala bandre, right, most likely you will have the virus sitting inside you, okay, right? Hepatitis C was considered the same category until 10 to 12 years back, right? Ega last 10 to 12 years there have been medicines which are developed which have revolutionized the hepatitis C treatment. So ega we are able to achieve a cure from hepatitis C with medications, okay? Hepatitis C genotypes anta irutte. Based on the genotype they're more likely that you will be cured with medicines itself, tablets, okay, right? Hepatitis B stays in your body for your lifetime, okay? The reason is hepatitis B is like the same mechanism as HIV, okay, right? ಏನು ಮಾಡುತ್ತೆ ಅದು DNA ಏನಿರುತ್ತೋ ವೈರಸಲ್ಲಿ that will go and integrate with the host DNA, okay, right? ಅದು ಇಂಟಗ್ರೇಟ್ ಆಗುವಾಗ the body cannot recognize whether this is virus or is it the body's own cell, okay, right? So ಆ ಥರ the virus has developed this camouflage, right? So ಆ ಥರ and it uses the body's mechanism, ಆ cell's mechanism to create more viruses, okay, right? So it's actually almost like a parasitic kind of like a relationship, but it integrates with the host, right? And that is the challenge we have found in trying to cure hepatitis B, right? So coming to your question about which is dangerous, in my opinion, hepatitis B is the most dangerous,
yes.
right? Although hepatitis B does not cause immediate issues, right? But in the long term, it causes the most damage, right? It is the most difficult to treat, right? Tablets ತಗೊಂಡು lifelong tablets ತಗೊಳ್ಬೇಕಾಗತ್ತೆ, right? Tablets side effects ಇದೆ. It's not that it's without side effects, right? And down the line, even if the hepatitis B is not caused significant liver damage, right? Tablets ತಗೊಂಡ್ರೇನು, right? There is a slight chance of liver cancer, right? So that is why I feel hepatitis B is the most dangerous. of the all the viruses.
In your practice, doctor, so ಇಷ್ಟು ವರ್ಷದ ಪ್ರಾಕ್ಟೀಸಲ್ಲಿ ನಿಮಗೆ ಹೆಪಟೈಟಿಸ್ ಅಂತ ಪೇಷಂಟ್ಸ್ ಬಂದಾಗ ತುಂಬ ಸುದೀರ್ಘವಾಗಿ ತುಂಬ ವರ್ಷಗಳವರೆಗೂ ಈ ಹೆಪಟೈಟಿಸ್ ವೈರಸ್ ಇತ್ತು ಅಂತ ಗೊತ್ತಾಗಿದ್ದು ಯಾವಾಗ, ಅಥವಾ ಎಷ್ಟು ವರ್ಷ ವೈರಸ್ ಅವರಲ್ಲಿ ಇದ್ದಿರಬಹುದು ಅಂತ?
ಕರೆಂಟ್ಲಿ ನಾನು ಡಯಾಗ್ನೋಸ್ ಮಾಡೋದು ಎಸ್ಪೆಷಲಿ ಹೆಪಟೈಟಿಸ್ ಬಿ ಇದು a lot of almost 90 to 95% of them are incidental. ಇನ್ಸಿಡೆಂಟಲ್ ಅಂದರೆ ದೇವ್ ಕಮ್ ಫಾರ್ ಸಮಥಿಂಗ್ ಟೋಟ್ಲಿ ಅನ್ರಿಲೇಟೆಡ್, ರೈಟ್? ಸರ್ಜರಿಗೆ ಏನಾದರೂ ಕ್ಯಾಟ್ರಾಕ್ಟ್ ಸರ್ಜರಿಗೆ ಬರ್ಬೋದು ಆರ್ ಸಮಥಿಂಗ್ ಎಲ್ಸ್, ರೈಟ್? ಸೊ ಆ್ಯಸ್ ಅ ಪಾರ್ಟ್ ಆಫ್ ನಾವು ಸರ್ಜರಿ ಮಾಡೋದು ಮುಂಚೆ ವಿ ಡೂ ದ hepatitis B, C and HIV for all the patients. ಯಾಕಂದರೆ ನಾವು we have to see what precautions to use during the surgery, right? So ಅದಕ್ಕೆ we do as a protocol, right? ಆವಾಗ hepatitis B diagnose ಆಗುತ್ತೆ. They would have no symptoms, they would have no history. Lot of times patients say, ಚಿಕ್ಕಿರುವಾಗ ಒಂದ್ಸಲ ಜಾಂಡಿಸ್ ಆಗಿತ್ತು, ಆದರೆ ನಾವು ಏನೋ
ಮಾಡಿದ್ವಿ,
ಅದೇ ಸ್ವಲ್ಪ ಏನೋ ಆಯುರ್ವೇದಿಕ್ ಟ್ಯಾಬ್ಲೆಟ್ ತೊಗೊಂಡಿತ್ತು, ಆದರೆ ಮನೆ ಹತ್ರ ಏನಾದರೂ ಇದು ಕೊಟ್ಟಿದ್ರು, ರೈಟ್? ಎಲ್ಲ ಓಕೆ ಆಯಿತು, ಏನೂ ಆಗಿಲ್ಲ ಅದಾದಮೇಲೆ, ರೈಟ್? ಆ್ಯಂಡ್ ನಾವು ಇನ್ಸಿಡೆಂಟ್ಲಿ ದೇ ವಿಲ್ ಹ್ಯಾವ್ ಹೆಪಟೈಟಿಸ್ ಬಿ, ಓಕೆ, ರೈಟ್? ಆದರೆ ಇಟ್ ಡಸಂಟ್ ಮೀನ್ ದಟ್ ಇನ್ಸಿಡೆಂಟ್ಲಿ ಡಿಟೆಕ್ಟೆಡ್ ಹೆಪಟೈಟಿಸ್ ಬಿ ನೀಡ್ಸ್ ಟು ಬಿ ಟ್ರೀಟೆಡ್, ಓಕೆ, ರೈಟ್? ಹೆಪಟೈಟಿಸ್ ಬಿ ಪಾಸಿಟಿವ್ ಇದೆ, ವಿ ಸಿ ಇಫ್ ದೆರ್ ಇಸ್ ಆಕ್ಟಿವ್ ಹೆಪಟೈಟಿಸ್ ಬಿ, ರೈಟ್? ಆಕ್ಟಿವಿಟಿ ಇದ್ದರೆ ಮಾತ್ರ ವಿ ಸ್ಟಾರ್ಟ್ ಆನ್ ಟ್ರೀಟ್ಮೆಂಟ್, ಓಕೆ? ಆರ್ ಇಫ್ ದೇ ಆರ್ ಅಂದರೆ patient is undergoing chemotherapy or patient is requiring some medication which the body's immunity will come down, right? So ಆ ಥರ ಸಿಚುವೇಷನಲ್ಲಿ we will start the treatment without any activity also, right? But otherwise we will treat only when the virus is active.
Okay.
Most people are diagnosed incidentally.
Okay. After listening this, I want to ask you something that 10 years back, 15 years back, 20 years back ಹೆಪಟೈಟಿಸ್ ಆಗಿ ಹೋದವರು ಅಥವಾ ಹೆಪಟೈಟಿಸ್ ಬಿ ಅಟ್ಯಾಕ್ ಆಗಿ ಹೋದಾಗ ಅವ್ರು ಹುಷಾರಾಗಿರ್ತಾರೆ ಅವಾಗ. ಈಗ ಅವ್ರು ಹೋಗಿ ಚೆಕ್ ಮಾಡಿಸ್ಕೋಬೇಕಾಗತ್ತಾ?
ಒಂದ್ಸಲ ಹೆಪಟೈಟಿಸ್ ಬಿ ಡಿಟೆಕ್ಟ್ ಆಗಿದ್ರೆ ಒನ್ಸ್ ಇಯರ್ ಚೆಕಪ್ ಮಾಡಬೇಕು. ಒನ್ಸ್ ಇಯರ್ ಐಡಿಯಲಿ ಗೈಡ್ಲೈನ್ಸ್ ಸೇ ಒನ್ಸ್ ಇನ್ 6 months. ಆದರೆ ದ ಹೆಪಟೈಟಿಸ್ ಬಿ ಚೆಕಪ್ ಈ ಟೆಸ್ಟ್ ಇಸ್ ವೆರಿ ಕಾಸ್ಟ್ಲಿ. Okay, right? So HPV DNA ಮಾಡಬೇಕಂದ್ರೆ it can come anywhere between 5,000 to 10,000 depending upon the lab. Okay, right? So if that is the case, then we try to find a middle ground. Okay, right? Ideally once in 6 months. Okay, but if money is a problem, at least once in a year ನಾನು ಹೇಳ್ತೀನಿ, right? Once in a year at least ನೀವು ಚೆಕಪ್ ಮಾಡಿ ತೋರಿಸ್ಬೇಕು. Why do they say once in 6 months? Because ಇದು ಹೆಪಟೈಟಿಸ್ ಬಿ ಆಕ್ಟಿವ್ ಆಗುವಾಗ you will have no symptoms. Right? Only ಅದು ಲಿವರ್ ಡ್ಯಾಮೇಜ್ ಸ್ಟಾರ್ಟ್ ಆಗುವಾಗ ದೆನ್ ಯು ವಿಲ್ ಹ್ಯಾವ್ ಸಿಂಪ್ಟಮ್ಸ್, ರೈಟ್? ಸೊ ಅದು ಸಿಂಪ್ಟಮ್ಸಿಗೆ ವೇಟ್ ಮಾಡಿದರೆ ಮೇ ನಾಟ್ ಬಿ ಅ ಗುಡ್ ಸ್ಟ್ರಾಟಜಿ, ರೈಟ್? ಸೊ ಯು ಹ್ಯಾವ್ ಟು ಕ್ಯಾಚ್ ಇಟ್ ವೆನ್ ಇಟ್ಸ್ ಇಮಿಡಿಯೇಟ್ಲಿ ಆಕ್ಟಿವ್. ಮೆಡಿಸಿನ್ಸ್ ಕೊಟ್ಟರೆ ಸಪ್ರೆಸ್ ಮಾಡಿ ಏನು ಲಿವರ್ ಡ್ಯಾಮೇಜ್ ಆಗಬಾರ್ದು ಅಂತ ನಾವು ಮಾಡ್ಬೋದು.
Then what are the symptoms?
Symptoms once they start can be symptoms of liver damage. ಅದನ್ನು ಏನು ಹೇಳಿದ್ದು, ಲಿವರ್ ಫಂಕ್ಷನ್ ಟೆಸ್ಟಲ್ಲಿ ಅಬ್ನಾರ್ಮ್ಯಾಲಿಟಿ ಬರುತ್ತೆ, ನಾನ್ ಸ್ಪೆಸಿಫಿಕ್ ಅಬ್ಡಾಮಿನಲ್ ಪೇನ್ ಇರ್ಬೋದು, ಓಕೆ, ಲೋ ಗ್ರೇಡ್ ಫೀವರ್ ಇರ್ಬೋದು, ಓಕೆ, ರೈಟ್? ಆರ್ ಬ್ಲೀಡಿಂಗ್ ಟೆಂಡೆನ್ಸೀಸ್, ಅಂದರೆ ನೀವು ಏನಾದರೂ ತಾಗುತ್ತೆ, ರೈಟ್? ಅದು ಬ್ಲೀಡಿಂಗ್ ನಾರ್ಮಲಿ ಸ್ವಲ್ಪ ಸೆಲ್ಫ್ ಲಿಮಿಟಿಂಗ್ ಇರಬೇಕು, ಆದರೆ ಜಾಸ್ತಿ ಇರುತ್ತೆ ಬ್ಲೀಡಿಂಗು, ರೈಟ್? ಈ ಥರ ಇರುವಾಗ ಯು ಹ್ಯಾವ್ ಟು suspect that there is some issue with the liver. One of the possibilities is hepatitis B.
Okay, urine and motion ಕಲರು ಹೇಳುತ್ತೆ ಹೆಪಟೈಟಿಸ್ ಆಗಿದೆ ಅಂತ.
ಹೈ ಕಲರ್ಡ್ ಇರ್ಬೋದು ಓನ್ಲಿ ವೆನ್ ದರ್ ಇಸ್ ಜಾಂಡಿಸ್.
ಯೂರಿನ್,
ಓಕೆ, ಯೂರಿನಲ್ಲಿ, ರೈಟ್? ಆ್ಯಂಡ್ ಓನ್ಲಿ ವೆನ್ ದರ್ ಇಸ್ ಜಾಂಡಿಸ್ ದಟ್ ವಿಲ್ ಹ್ಯಾಪನ್. ಆದರೆ ಹೆಪಟೈಟಿಸ್ ಬಿ ಕಮಿಂಗ್ ವಿತ್ ಫ್ರ್ಯಾಂಕ್ ಜಾಂಡಿಸ್ ಅಂದರೆ ಇಟ್ಸ್ ಆಬ್ವಿಯಸ್, ಅಂದರೆ ಯು ವಿಲ್ ಕಮ್ ವಿತ್ ಅ ಲಾಟ್ ಆಫ್ ಸಿಂಪ್ಟಮ್ಸ್. ಊಟ ಮಾಡೋಕ್ಕಾಗಲ್ಲ, ವಾಮಿಟಿಂಗ್ ಇರುತ್ತೆ, ಅದೆಲ್ಲ ಇರುತ್ತೆ, ರೈಟ್? ಬಟ್ ದ ಸಬ್ ಕ್ಲಿನಿಕಲ್ ಒನ್ಸ್ ಐ ಟೋಲ್ಡ್ ಯು, ನಾನ್ ಸ್ಪೆಸಿಫಿಕ್ ಆಗಿ ಅಬ್ಡಾಮಿನಲ್ ಡಿಸ್ಕಂಫರ್ಟ್ ಇರುತ್ತೆ, ಲೋ ಗ್ರೇಡ್ ಫೀವರ್ ಇರ್ಬೋದು, ರೈಟ್? ಬ್ಲೀಡಿಂಗ್ ಟೆಂಡೆನ್ಸೀಸ್ ಇರ್ಬೋದು, ರೈಟ್? The women can come with menstrual bleeding which is increased, right? So ee tara iruvaga we have to suspect something is going on with the liver, and if hepatitis B known patient andre we have to suspect that the hepatitis B has already started acting.
Okay, when we are talking about the symptoms, actually ಕೆಲವೊಂದು ತಿಂಗಳಲ್ಲಿ ಹೆಣ್ಮಕ್ಳಿಗೆ ತುಂಬ ಜಾಸ್ತಿ ಬ್ಲೀಡ್ ಆಗಿಬಿಡುತ್ತೆ. ಜಾಸ್ತಿ ಬ್ಲೀಡಿಂಗ್ ಆಯಿತು ಅಂತಂದರೆ ದೆರ್ ವಿಲ್ ಬಿ ಮೆನಿ ಕಾಸಸ್. ಬಟ್ ವೆನ್ ವಿ ಆರ್ ಟಾಕಿಂಗ್ ದಿಸ್, ನನಗೆ ಹೆಪಟೈಟಿಸ್ ಆಗಿಬಿಟ್ಟಿದೆಯಾ ಅಂತ ಅಂದ್ಕೊಳ್ತಾರೆ. ಆ ಬ್ಲೀಡಿಂಗ್ ಜೊತೆಗೆ ಬೇರೆ ಸಿಂಪ್ಟಮ್ಸ್ ಇದ್ದಾಗ ಹೆಪಟೈಟಿಸ್ ಅಂತ ನಾವು ಡಯಾಗ್ನೋಸ್ ಮಾಡ್ತೀವ, ಅಥವಾ ಬ್ಲೀಡಿಂಗ್ ಜಾಸ್ತಿ ಆದ ತಕ್ಷಣ ನಾವು ಟೆಸ್ಟ್ ಮಾಡ್ಕೋಬೇಕಾಗತ್ತಾ?
ನೋ, ಇಟ್ ಇಸ್ ನಾಟ್ ದಟ್. ಇದು ವಿತ್ ದಿ ಅದರ್ ಸಿಂಪ್ಟಮ್ಸ್ ಇಫ್ ಇಟ್ ಇಸ್ ದೇರ್ ಓನ್ಲಿ ದೆನ್ ಹೆಪಟೈಟಿಸ್ ನಾವು ಸಸ್ಪೆಕ್ಟ್ ಮಾಡ್ತೀವಿ. ಆರ್ ಪರ್ಸಿಸ್ಟೆಂಟ್ ಅಂದರೆ 1 or 2 months ಚಿಕ್ಕ ವಯಸ್ಸಲ್ಲಿ ಆಗುತ್ತೆ, right? It's not that it is unheard of, right? So usually ಅವ್ರು ಹೇಳ್ತಾರೆ more than 3 months continuously ಇದು change in pattern of menstrual ಇದ್ರೆ then we have to evaluate. Okay, right?
So ನಾವು ಚಿಕ್ಕವರಿದ್ದಾಗ ತುಂಬ ಕೇಳ್ತಿದ್ವಿ ಡಾಕ್ಟರ್, ಕೆಲವು ಹೆಪಟೈಟಿಸ್ ಆಗಿತ್ತು, ಜಾಂಡಿಸ್ ಆಗಿತ್ತು, ಅದಕ್ಕೆ ತೀರ್ಕೊಂಡ್ರು, ತುಂಬ ವರ್ಷ ಇತ್ತಂತೆ, ಗೊತ್ತೇ ಆಗಲಿಲ್ಲ, ಲಾಸ್ಟ್ ಮೂಮೆಂಟಲ್ಲಿ ಕರ್ಕೊಂಡು ಹೋದ್ರು, ಏನೂ ಮಾಡೋಕ್ಕಾಗಲಿಲ್ಲ ಅಂತ. ಸೊ ಆ ಕೇಸಸ್ ಈಗಲೂ ಇದಾವ ಅಥವಾ ಕಮ್ಮಿ ಆಗಿದಾವ?
ಡೆಫಿನೆಟ್ಲಿ ಇದೆ. ಇಟ್ಸ್ ನಾಟ್ ರಿಲೇಟೆಡ್ ಓನ್ಲಿ ಟು ಹೆಪಟೈಟಿಸ್ ಬಿ ಈ ಥರ ಕೇಸಸ್. ಓಕೆ ರೈಟ್, ವಾಟ್ ಯು ಆರ್ ರೆಫರಿಂಗ್ ಟು ಇಸ್ ಆ್ಯಕ್ಚುಲಿ ಲಿವರ್ ಸಿರೋಸಿಸ್. ಓಕೆ ರೈಟ್, ಲಿವರ್ ಸಿರೋಸಿಸ್ ಅಂದರೆ ಲಿವರ್ ಡ್ಯಾಮೇಜ್ ಹ್ಯಾಸ್ ಪ್ರೋಗ್ರೆಸ್ಡ್ ಟು ಅ ಪಾಯಿಂಟ್ ವೇರ್ even 30% of the liver is not functioning, right? So liver functions kadme aagta ide ಈಗ, right? ಆವಾಗ jaundice ಬರೋದು, right? For this progression, right, it can take anywhere between months to years. Okay, right? So that is what people say, jaundice ಬಂದು ಆದರೂ ತೀರೋದ್ರು ಅಂತ. Okay, right? Hepatitis B is one of the causes of cirrhosis. Okay, right? So cirrhosis ಗೆ multiple etiologies ಇರುತ್ತೆ, right? It can be hepatitis B and C, it can be NASH ಅಂತ, NASH ಅಂದರೆ fatty liver, okay, right? It can be alcohol, okay, right? So all these are possible etiologies of cirrhosis, okay, right? So what you are referring to is probably cirrhosis, which is undiagnosed for a long time, and then symptoms ಬಂದಾಗ it is very difficult to save them.
And what about dengue?
Dengue and even malaria, right?
yes.
Dengue, malaria, right? All these are viruses which are not specific for the liver.
Okay.
Right? So they are viruses that can cause infection. Adre as part of that infection, liver go ತೊಂದರೆ ಬರ್ಬೋದು. Okay, right? Viral hepatitis A to E are specific. Once it enters the body, it goes straight to the liver and sits there. Okay, right? Dengue is ಎಲ್ಲ ಬಾಡಿಯಲ್ಲಿ ಸ್ಪ್ರೆಡ್ ಆಗುತ್ತೆ. As part of that, liver go affect ಆಗ್ಬೋದು, right? Direct damage to the liver is very unlikely with dengue and malaria, although it's to a certain extent it's there, but more likely it is the body, the systemic response, right, which then leads to liver damage and other collateral damage. Okay, right? So now ಹೇಳ್ತೀವಿ ಇದಕ್ಕೆ hepatitis ಅಂತ ಹೇಳ್ತೀವಿ, but commonly when we refer to viral hepatitis, we do not include dengue or malaria. Okay, right? We only refer to these viruses, hepatitis A to E.
ಓಕೆ, ಸೊ ಡಯಟ್ ಮಾಡೋರು ಕೀಟೋ ಡಯಟ್ ಒಂದು ಕಡೆ ಇರುತ್ತೆ, ಪ್ರೋಟೀನ್ ಡಯಟ್ ಒಂದು ಕಡೆ ಇರುತ್ತೆ, ಮತ್ತೊಂದು ಡಯಟ್ ಒಂದು ಕಡೆ ಇರುತ್ತೆ. ವಾಟರ್ ಡಯಟ್ ಮಾಡೋರ ಸಂಖ್ಯೆನೂ ಕೂಡ ಜಾಸ್ತಿ. ಸೊ ಅವ್ರಿಗೇನು ಅಡ್ವೈಸ್ ಕೊಡ್ತೀರಿ?
ಸೊ ಡಯಟ್ ಮಾಡೋದು, ಸಿ ಐ ಥಿಂಕ್ ನ್ಯೂಟ್ರಿಷನ್ ಆ್ಯಂಡ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಇಸ್ ಅ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಆಸ್ಪೆಕ್ಟ್ ಆಫ್ ಲಿವರ್ ಡಿಸೀಸಸ್. ಓಕೆ ರೈಟ್, ಈಗ ದ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಆಸ್ಪೆಕ್ಟ್ ಇಸ್ ಫ್ಯಾಟಿ ಲಿವರ್. ಓಕೆ ರೈಟ್, ಐ ಆಮ್ ಶೋರ್ ಯು ಹರ್ಡ್ ಆಫ್ ಫ್ಯಾಟಿ ಲಿವರ್, ರೈಟ್? So fatty liver is very common. 30% of the population of India is estimated to have fatty liver, right? 1 in 3. So idella fat diets, 1 in 3.
Okay.
1 in 3 has fatty liver. Okay, right? So idella fat diets nodidre, fat diets andre keto diet, high protein, Atkins diet idella, right? It is mainly short term diets for immediate shortcuts to weight loss. Okay, right? It has no bearing on long term health. In fact, idella diets ige there has been data that suggests that long term it will be detrimental to your body and to your liver specifically, liver and pancreas. Okay, right? So I don't recommend any of these diets. What I do recommend is to have a balanced diet. Okay, right? Specific situations ಅಲ್ಲಿ, suppose there are diabetic patients, there are hypertensive, already ಕಾಯಿಲೆ ಇರೋದವರು, right, comorbidities ಇರೋದವರು, they can be on a more restrictive diet, right? But if you're looking at general health, right, balanced diet should be the way to go. Okay, in balanced diet ನಿಮಗೆ ಕಾರ್ಬ್ ಸ್ವಲ್ಪ ಕಡಿಮೆ ಮಾಡಬೇಕಂದ್ರೆ I completely understand, but it should not be to an extent where your main nutrition source should not be proteins. Okay, proteins is only for body processes and building of muscle and a few and immunity, right? Proteins cannot be used for fuel. Carbohydrate is the fuel.
Yes.
Right? So ಆ ಥರ ಮೇಂಟೈನ್ ಮಾಡಬೇಕು, right? So balanced diet would be my recommendation instead of any of these specialized fat diets.
Actually, when we are talking about fatty liver, I think you may heard or you may see many cases ಅಥವಾ some cases like fatty liver ಅಂದ ತಕ್ಷಣ ಫ್ಯಾಟ್ ಕಂಟೆಂಟ್ ಇರೋದನ್ನ ತಿಂದರೆ ಫ್ಯಾಟಿ ಲಿವರ್ ಆಗ್ಬಿಡುತ್ತಾ ಅನ್ನೋ ಮಿತ್ ಇರುತ್ತೆ. ಆ್ಯಕ್ಚುಲಿ ಫ್ಯಾಟಿ ಲಿವರ್ ಹ್ಯಾಪನ್ ಬಿಕಾಸ್ ಆಫ್ ಆಲ್ಕೋಹಾಲ್, ಸ್ಮೋಕಿಂಗ್ ಆ್ಯಂಡ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಅಂತ ಹೇಳ್ತಾರೆ. ಬಟ್ ಫ್ಯಾಟ್ ಕಂಟೆಂಟ್, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಎಗ್ ಯಾಕ್ ಅಥವಾ ಅವಕಾಡೋ ಅಥವಾ ಬೇರೆ ಬೇರೆ ಫ್ರೂಟ್ಸ್ ಆಗಿರ್ಬೋದು, ಅಥವಾ ಬೇರೆ ಬೇರೆ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಫಿಶ್, ಚಿಕನ್ ತಿಂದರೆ ಫ್ಯಾಟಿ ಲಿವರ್ ಆಗಿಬಿಡುತ್ತಾ ಅನ್ನೋ ಮಿತ್ತಿದೆ. ಇದ್ರ ಬಗ್ಗೆ ಏನು ಹೇಳ್ತೀರಿ?
Absolutely false. ಇದು ಫ್ಯಾಟಿ ಲಿವರ್, ಯು ಆರ್ absolutely correct in terms of fatty liver is not just deposition of fat. Okay, right? There is a reason for it. Okay, right? One of the reasons can be alcohol. Idu viral hepatitis indanu fatty liver barutte, right? Or it can be lifestyle associated. Lifestyle alli diet. So just consuming fats is not harmful. Okay, right? it is the quality and the quantity of fats that you consume. Okay, right? And how much your body structure requires, right? Ad nodbeku. Okay, right? Indians actually do not require a lot of fats. Okay, right? Because we are traditionally, if you look at our genetic structure, right? Now, salpa jasti tindrenu, we will start putting on weight in the
Correct.
midriff, okay, in the center. That is because we do not require, that is all surplus, okay, right? We are a culture where carbohydrates is the king, right?
True.
We are a rice-based or a
True.
wheat-based culture,
Yes.
right? So we are able to tolerate that in much higher quantities, but we are not able to tolerate the fats in high quantities, okay, right? Very interesting story in our health in India.
Yes.
Okay, right? When they looked at this fat content, okay, right? ಇದಕ್ಕೆ ವಿಸರಲ್ ಅಡಿಪೋಸ್ ಟಿಶ್ಯೂ ಅಂತ ಹೇಳ್ತೀವಿ. ಓಕೆ, ರೈಟ್? ನಾವು ವಿಸರಲ್ ಅಡಿಪೋಸ್ ಟಿಶ್ಯೂ ಅಂದರೆ ಇಟ್ ಇಸ್ ದ ಫ್ಯಾಟ್ ದಟ್ ಇಸ್ ಅರೌಂಡ್ ದ ಆರ್ಗನ್ಸ್.
Okay.
Okay, not the fat that we see on our hands and abdomen. Okay, right? ಇದೆಲ್ಲ ಡಿಸೀಸಸ್ ಬರೋದು is because of visceral adipose tissue. It's not because of the fat that is deposited on our body. Okay, subcutaneously. Okay, right? So the person who came up with it, there were two scientists, Yuri and Yagnik. One was an Indian, he's from Pune, right? And Yuri is a Russian, right? And that this is called a YY paradox. Okay, right? They found that they were the first ones to talk about this visceral adipose tissue, right? Yuri is a very big person, andre he is very broad and
Healthy,
big,
yeah.
healthy, right? Russian man. Yagnik is very thin,
Okay.
tall and lanky, right? ಅವ್ರು ನೋಡಿದ್ರೆ ಸೈಡ್ ಬೈ ಸೈಡ್ ಯು ವಿಲ್ ಸೇ ಇವರಿಗೆ ಫ್ಯಾಟಿ ಲಿವರ್ ಇರ್ಬೋದು, ಇವರಿಗೆ ಫ್ಯಾಟಿ ಲಿವರ್ ಇರ್ಬೋದು.
Okay, yeah.
Okay, right? But if you look at their visceral fatty tissue, right? The Indian Yagnik had a much higher visceral adipose tissue than Yuri, right?
Okay.
And andre to the point where it was 18 or 20% and the other person had some 4%.
Okay.
So that was the difference, right? So just by your appearance, just by consuming the amount of fat that you have is not important. It is the quantity and the quality of fats that you consume, right? Processed fats, processed food, ultra processed food, right? These are the things which will definitely spike your sugar, insulin jasti agutte, and then all this will lead to increase in visceral adipose tissue. Okay, right? So although you might be thin, right? If your visceral adipose tissue is high, then you are at risk. Okay, which is what we are seeing in Indians. Okay, in India it is called lean NASH. Lean NASH andre they are thin but they have quite bad fatty liver.
Okay.
Okay, right? And it's a very challenging situation to treat. Right? Because normally ನಾವು ಫ್ಯಾಟಿ ಲಿವರಿಗೆ ಏನು ಮಾಡ್ತೀವಿ, ವೇಟ್ ಲಾಸ್ ಅಂತ ಹೇಳ್ತೀವಿ.
ಹೌದು.
ಆದರೆ ಆಲ್ರೆಡಿ ಲೀನ್ ಇದ್ರೆ, ರೈಟ್, ದೆನ್ ವಾಟ್ ಡು ವಿ ಡೂ, ರೈಟ್? ಸೊ that's when the medicines come in.
Okay,
Right?
okay.
So these are the things that lifestyle changes, medicine, these are the things that we need to look at in these situations.
If we take percentage wise, alcohol, smoking, lifestyle, ಯಾವುದ್ರ ಪರ್ಸೆಂಟ್ ಜಾಸ್ತಿ ಇದೆ ಫ್ಯಾಟಿ ಲಿವರ್ ಬರೋದಕ್ಕೆ?
Fatty liver ಬರೋದಕ್ಕೆ the most common is alcohol currently. Okay, right? But I feel the metabolic disease associated, ಅದಕ್ಕೆ MASLD ಅಂತ ಹೇಳ್ತೀವಿ. Before it used to be called non-alcoholic fatty liver disease. ಈಗ we call it metabolic disease associated, MASLD. MASLD I think is fast becoming the most common. Okay, right? So soon MASLD will overtake alcohol, right? And there is a opinion now that it may not be separate. Okay, right? So people who drink even moderate amounts of alcohol with diabetes, with hypertension, who are overweight, right? Eradu operate ಆಗ್ತಾ ಇದೆ. Not just the alcohol induced damage, but also the metabolic disease associated damage, right? ಒಟ್ಟಿಗೆ it is causing the liver damage ಅಂತ ಬರ್ತಾ ಇದೆ ಈಗ, right? What we call as MET ALD. So these are, I feel that is the highest percentage would be MET ALD, which is a combination of the two, right? Viral hepatitis, smoking, all the other causes occupy a much lower percentage, right? So the most common would be alcohol and metabolic disease.
ಓಕೆ. ಸೊ ಹೆಪಟೈಟಿಸ್ ಇರೋರು ಆಲ್ಕೋಹಾಲ್ ತಗೊಂಡ್ರೆ ಅಥವಾ ಡ್ರಿಂಕ್ಸ್ ಮಾಡ್ತಾ ಇದ್ರೆ, ಗೊತ್ತಿದ್ದು ಡ್ರಿಂಕ್ಸ್ ಮಾಡ್ತಾ ಇದ್ರೆ, ಗೊತ್ತಿಲ್ಲದೇನೂ ಡ್ರಿಂಕ್ಸ್ ಮಾಡ್ತಾ ಇದ್ರೆ, ಅದು ಫ್ಯೂಯಲ್ ಹಾಕ್ದಂಗೆ ಆಗುತ್ತೆ ಹೆಪಟೈಟಿಸ್ಗೆ ಅಂತಾರೆ. ಇಸ್ ದಟ್ ಟ್ರೂ?
Yes, that is absolutely true. Not just alcohol. Patients who have hepatitis B, right, ಅವ್ರದ್ದು ಡಯಟ್ ಎಕ್ಸಸೈಸ್ ಸರಿ ಮಾಡ್ತಾ ಇಲ್ಲ, ವೇಟ್ ಗೇನ್ ಆಗ್ತಾ ಇದ್ರೆ, it is definitely going to add on. And add on andre, it is not just 1+2 add on, it is exponential increase, right? So the risk for all complications including cirrhosis and liver cancer is much higher in these patients, right? So hepatitis irodor patients, so they have to take extra care, make sure they don't drink alcohol, no smoking, and also lose weight and adopt a very healthy lifestyle.
Okay, so nowadays we are getting, not nowadays, from early age also, we are getting hepatitis in small kids also. For them it's very difficult to do diet.
Yes.
ಸೊ ಅಂಥ ಮಕ್ಕಳಿಗೆ ಏನು ಮಾಡಬೇಕು, ಹೇಗೆ ಕ್ಯೂರ್ ಆಗುತ್ತೆ?
See, ಚಿಕ್ಕ ಮಕ್ಕಳು ಬಂದಾಗ it is most likely transferred through mother and baby, through the pregnancy.
Okay, yeah.
Vertical transmission. Okay, right? So ಆ ಥರ ಇರುವಾಗ it actually causes more damage in the baby over a period of time, right? Because the baby is living with the virus for much longer, right? ನಮಗೆ virus in their 40s 50s ಬಂದ್ರೆ, as compared to if you get it at birth, right? You're going to be living a much longer life with the virus, right? So ಆವಾಗ complications ಜಾಸ್ತಿ ಇರುತ್ತೆ. We treat these with medications, and they most likely have to be with lifelong medications, right? A lot of them will have cirrhosis, will need liver transplant at some point during their life, right? But the number of cases that we see is coming down a lot, right? There's two reasons for that. One is all pregnant mothers are being tested for the hepatitis B,
yeah.
right? And ಏನಾದರೂ ಪಾಸಿಟಿವ್ ಇದ್ದರೆ immediately medicine start ಮಾಡಿದರೆ, that itself prevents transmission to the baby, right? Most often the transmission of virus happens in the last trimester, okay, right? Adu one. Second is the vaccine, okay, right? So all babies are vaccinated as per national immunization schedule, right? So ega once the vaccine has come in, we are seeing very, very less hepatitis B in children,
which is good for our country.
Absolutely.
Okay. Absolutely. And there is one more thing, doctor. So hepatitis ಬಗ್ಗೆ ಇರೋ ಮಿತ್ಸ್ ಯಾವುದು? ನಿಮ್ಮ ಹತ್ರ ಪೇಷಂಟ್ಸ್ ಬಂದಿರ್ತಾರೆ, ಸುಮಾರು ಪೇಷಂಟ್ಸ್ಗಳನ್ನು, ಥೌಸಂಡ್ಸ್ ಆಫ್ ಪೇಷಂಟ್ಸ್ ಯು ಹ್ಯಾವ್ ಹ್ಯಾಂಡಲ್ಡ್ ಆ್ಯಂಡ್ ಪ್ರಾಕ್ಟೀಸಲ್ಲಿ ನೋಡಿದ್ದೀರಾ. ಸೊ ಈ ಮಿತ್ ಕೇಳಿ ನಿಮಗೆ ನಗು ಬಂದಿದ್ದು ಯಾವುದು?
One of the most common things is hepatitis B ಇರೋದವರು, ಎಸ್ಪೆಷಲಿ ಇನ್ ದ ಫ್ಯಾಮಿಲಿ, ಅವ್ರಿಗೆ ಸೆಪ್ರೇಟ್ ರೂಮ್ ಬೇಕಾ, ಸೆಪ್ರೇಟ್ ಬಾತ್ರೂಮ್ ಬೇಕಾ, ಸೆಪ್ರೇಟ್ ಇದು ಬೇಕಾ ಅಂತ. It is not true, right? That is absolutely not required.
ಟಚ್ ಮಾಡಿದ್ರೆ
ಆ ಥರ ಟಚ್ ಮಾಡಿದ್ರೆ ಬರುತ್ತಾ, right? A lot of times ಇದು married couples have come, recently married couples, right? And then diagnosed with hepatitis B. So their concern is, ಈಗ should we not have kids at all, right? So ಆ ಥರ it's not at all the case, okay, right? You can live a very normal life with hepatitis B, okay, right? Very normal andre as normal as the next person, okay, right? Just that ನೀವು blood test regularly ಮಾಡಬೇಕು, ಚೆಕಪ್ ರೆಗ್ಯುಲರ್ಲಿ ಮಾಡಬೇಕು. Apart from that, nothing else. Everyone in the house should be vaccinated, right? Not because of anything else. It's not that it will spread from person to person ಆ ಥರ, right, in the house, right? But we don't know why that person has had the hepatitis B in the first place. ಏನಾದರೂ ಕಾಮನ್ ಸೋರ್ಸ್ ಇರ್ಬೋದು, like for example, they are going to the same barber shop where they get the same shave, right? So ಆ ಥರ ಇರುವಾಗ, since we don't know the source, right, so it is always better to vaccinate all the household contacts of patients of hepatitis B.
Okay.
Once ಎಲ್ಲ ವ್ಯಾಕ್ಸಿನೇಟ್ ಆಗಿದ್ರೆ, they have no problems.
Okay. Hepatitis B ಇರೋನು ಊಟ ಮಾಡ್ತಾ ಇದ್ದಾಗ ನಮಗೂ ತಿನ್ಸಿದ್ರೆ ಬರುತ್ತಾ?
Very, 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 very unlikely. Okay, right? The amount of virus that needs to be put, andre, if you look at what is required for infection, right, is already, quite high. So ashtu virus irbeku a saliva dalli, right? And saliva is one of the fluids where the virus is least, right? Highest is the blood, right? Then it is sexually transmitted, right? Then this one will be serum, adu ಕೊಡುವಾಗ, ಬ್ಲಡ್ ಟ್ರಾನ್ಸ್ಫ್ಯೂಷನ್ ಕೊಡುವಾಗ, ರೈಟ್? ಬಟ್ ಅದರ್ವೈಸ್ ಸಲೈವಾ ಇಸ್ ದ ಲೀಸ್ಟ್, ಓಕೆ, ರೈಟ್? ಸೊ ಐ ಡೋಂಟ್ ಥಿಂಕ್ ದಟ್ ಈಸ್ ಅ ವಯಬಲ್ ಸೋರ್ಸ್ ಆಫ್ ಇನ್ಫೆಕ್ಷನ್.
ಓಕೆ. ಸೊ ಹೆಪಟೈಟಿಸ್ ಇರೋ ಪಾರ್ಟ್ನರ್ಸಿಗೆ ಏನು ಅಡ್ವೈಸ್ ಕೊಡ್ತೀರಿ?
Vaccinate immediately, vaccinate completely, right? And booster shot every 5 years.
Okay. What about the vaccinations? ಯಾವ ಏಜ್ ಇಂದ ಸ್ಟಾರ್ಟ್ ಆಗುತ್ತೆ, ಹೇಗಿರುತ್ತೆ? Any age.
You can give it immediately after birth also, right? Which is what happens in ಮದರಿಗೆ undiagnosed ಇದ್ರೆ, and then mother has come in, say the last trimester or something, and aವಾಗ diagnose ಆಗಿದ್ರೆ, right? Then the baby is given vaccination immediately after the birth, okay, right? And immunoglobulin ಅಂತಾನು ಕೊಡ್ತೀವಿ ಬೇಬಿಗೆ, Okay, right? You can vaccinate at any age. It is an extremely safe vaccine, right? We've had years and years of data, right? Person who developed that hepatitis B vaccine was in the 1980s, right? And he won the Nobel Prize for it. Okay, right? And I think everyone should be vaccinated. Okay, right? I'm very happy that it's come in national immunization, right? It came only in the 2010s, right? So before that, we have not been vaccinated. So I think everyone should be vaccinated, right? Especially people who are in high risk situations, right? Nam hospital dalli, as protocol, we give hepatitis B vaccine for all healthcare workers, starting from the doctors to the housekeeping staff also,
Okay.
right? And we make sure, I'm also the chairman of the hospital infection control committee, right? So every committee meeting alli, we check how many of them have been missed, how many of them are pending, right? And immunization is completed for all healthcare workers. I'm not saying we are only the only hospital that does it. All hospitals do it, okay, right? But in my opinion, most adults, there is no harm in taking the vaccine, right? The only chance is of allergy and reactions, right? Adu tumba, it's very, very rare, right? And bandrenu, after that, you don't have to take the vaccine, ashte, right? So in my opinion, better to get the vaccine than not get the vaccine.
How many vaccine we have for hepatitis?
The dosing schedule is 3 doses that needs to be given,
Okay.
right? Most commonly used schedule is 016, ಅಂದ್ರೆ ಇವತ್ತು ಒಂದು ಡೋಸ್ ಕೊಟ್ರೆ 1 month ಆದ್ಮೇಲೆ ಸೆಕೆಂಡ್ ಡೋಸು 6 month ಆದ್ಮೇಲೆ ಥರ್ಡ್ ಡೋಸ್, okay, right? And a booster every 5 years is indicated. That would be only for high risk or contacts of hepatitis B. ಅವ್ರಿಗೆ ಮಾತ್ರ 5 years booster dose ಕೊಡೋದು is fine.
Is it easily available every hospital?
It is.
Or my basic concern is, my main concern is the rural places.
Yes, it is available. Okay, by and large, it's available. It is extremely cheap. Okay, right? It is not expensive. So vaccinating rural population is also going to be very easy, right? We do vaccination drives also as part of Ramaiah, right? As part of our outreach program, right? And the costing nodidre, when we take it directly from the company, the costing nodidre per shot, it will come to about 60 rupees.
Okay.
Okay, right? 55-60 rupees. Ashte. Okay, right? So it's that cheap and it's available. Recently, salpa supply chain issues bandide for hepatitis B. So we are finding it a little difficult to source the hepatitis B vaccine, right? Otherwise, it will get sorted soon, right? But otherwise, it's by and large available and it is accessible and cheap, right?
Okay.
So it is a very feasible vaccination strategy. WHO has come up with this, right? It is based on the fact that hepatitis B is so easily accessible, vaccine is so accessible, very safe, right? And can be produced at such a low cost, right? So that is the reason
Yes.
why, once you have 100% vaccination, right, you have pretty much eradicated the disease. Smallpox disease eradicate akito, same way, right? So that is why, WHO has put hepatitis as one of the diseases which should be eradicated by a certain time.
Which is the most complicated case you have seen even in your practice?
With relation to hepatitis,
Yes, yes.
right? So complicated case would be a hepatitis B, which is usually coming in with cirrhosis and liver cancer. Okay, right? So these are fairly common. I'm not saying this is not common, right? But treating these diseases becomes very challenging, right? Especially now transplant nodbekandre, right? So even then the liver cancer irbodu, hepatitis B can reactivate because liver tegdreno, hepatitis B is not going out of the body. Okay,
Oh.
right? So you won't have a full cure of hepatitis B.
Okay.
Right? Because it is
Agadi-
part of the DNA,
DNA, okay.
right?
Yes.
So it is part of the DNA, right? So even if you remove it, you may not necessarily have a cure, right? So ಆಮೇಲೆ ಇದು liver transplant ಆದ್ಮೇಲೆ we are giving immunosuppressants. ಇದು rejection ಆಗಬಾರ್ದು ಅಂತ we give medicines to reduce the immunity, right? So that is like a playground for hepatitis B. Yaru police illa, right? I can do whatever I want, right? So reactivation of hepatitis B is also very common, right? And it's very challenging to treat these cases, right? So these are the situations which are challenging from a medical point of view, right? The most difficult case in terms of handling a patient, right, is usually in the scenario where it is unexpected,
Okay,
right?
yes.
And it is a lifelong disease, right? Especially when you look at new mothers, okay, right? And for them, already pregnancy is such a difficult situation, right? Now medicines also is limited. We can't give all the medicines during pregnancy, right? So options are limited, right? It's such a stressful period, right? And for them, they feel that they are giving the disease to the baby, right? So talking to them, counseling them, I think is one of the most difficult
Complicated issue.
conversations
Yeah.
to have.
ಹೆಪಟೈಟಿಸ್ ಬಗ್ಗೆ ಆಗ್ತಿರೋ ಇನ್ವೆನ್ಷನ್ ಆಗಿರ್ಬೋದು, ವ್ಯಾಕ್ಸಿನ್ ಡ್ರೈವ್ಸ್ ಆಗಿರ್ಬೋದು, ಇದನ್ನೆಲ್ಲ ನೋಡ್ತಾ ಇದ್ರೆ WHO ಏಮ್ ಏನಿದೆ 2030 ಅಷ್ಟೊತ್ತಲ್ಲಿ ಇಸ್ ಇಟ್ ಬಿಕಮ್ ಟ್ರೂ?
If you are asking me ಇದು feasible ಇದೆಯಾ ಇಲ್ಲ ಅಂತ, I think it is feasible.
ಓಕೆ.
Okay, right? I think it is feasible because we have a vaccine which is extremely effective and easily accessible and available. Okay, right? But it is not easy. Okay, right? Because it requires large scale awareness. It requires vaccines to be given to a huge population, right? And at the same time, you have a lot of andre nimigenu tondre illa, right? Why would you take a vaccine, right? So that kind of like discourse and that kind of conversation, ಈಗ ನೋಡಿ anti-vaxxers ಬರ್ತಾ ಇದೆ. We are going back to where we were about 60 years back, right? Where people are doubting the efficacy of vaccines. They don't understand that we have eradicated diseases due to vaccines. But anti-vaxxers are a very common thing, especially in the Western countries, right? In India, so far, we've not had that issue, right? We are very aware and we are vigilant. And a lot of times, if the doctor tells you that you need to do it, the patients believe that, right? In the West, they don't do that, right? So there's a lot of systemic problems that comes in, right? Whether it is feasible as a strategy, 100%,
Okay.
right? But because of the systemic issues is what I'm concerned with, whether we'll be able to reach that goal in 2030 or whether we'll be able to reach that goal in 2050. But it is my firm belief that we will do it. It will be. At a certain point, we will be able to eradicate it.
ಓಕೆ.
Okay, right? Because the vaccine is so good.
ವೆಲ್ ಸೆಟ್. ಆ್ಯಂಡ್ ಥಿಂಗ್ ಈಸ್ ಹೆಪಟೈಟಿಸಲ್ಲಿ ಎಷ್ಟು ಸ್ಟೇಜಸ್ ಇದೆ?
So viral hepatitis andre acute hepatitis alli there will be 3 stages. Okay, right? Initially just fever barutte, body ache barutte, myalgia like viral fever irutte. Second stage alli jaundice barutte. Third stage alli there will be the improvement of the infection. Okay, ಸ್ವಲ್ಪ itching ಎಲ್ಲ ಇರುತ್ತೆ, otherwise nothing else, right? Chronic hepatitis andre it will be initial infection, there will be chronic hepatitis where there is swelling of the liver, right? And then finally it can go to cirrhosis, and then finally it will go to liver cancer. Okay, right? Ella patients ke liver cancer anta alla, right? It can be a few patients, a small proportion will go into cancer, right? But it is still a feasibility.
Okay.
It's possible.
ಲಿವರ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟ್ಸ್ ಯಾವ ಏಜಿಂದ ಯಾವ ಏಜ್ವರೆಗೂ ಮಾಡಬಹುದು?
Any age.
ಎನಿ ಏಜ್.
Any age. It depends on the surgeon's capability,
Correct.
right? The center's infrastructure and capability, right? And there it incurs a significant financial load. So adu that you need to look at, right? But any age can undergo liver transplant, but the indication has to be solid. Ashte.
ಓಕೆ. ಸೊ ಸಿದ್ಧಗಂಗಾ ಸ್ವಾಮೀಜಿಗಳು 4 years ಬ್ಯಾಕ್ ಅವ್ರು ತೀರ್ಕೊಂಡ್ರು. ಮೋರ್ ದೆನ್ 5 times ಅವ್ರದ್ದು ಲಿವರ್ ಟ್ರಾನ್ಸ್ಪ್ಲಾಂಟೇಷನ್ ಆಗಿತ್ತು.
Yes.
ಡಾಕ್ಟರ್ ರೋಹಿಲ್ಲಾ ಅದನ್ನು ಮಾಡ್ತಿದ್ರು. ಸೊ ಆ ಕೇಸ್ ನೋಡಿದ್ಮೇಲೆ ನಿಮ್ಗೆ ಏನು ಅನ್ನಿಸ್ತು ಡಾಕ್ಟರ್?
It's not that. See, recurrence of problems can be there. Okay, right? Idu post-transplant complications nodidre, there are multiple complications, but one of them is graft failure. Okay, right? So now yen haaktivo, it doesn't work in the way we want it to work. Adu. Second, adu yen medicines now kodabeku to prevent that rejection. That our medicines in the side effect bartha idre patient ke they're not able to tolerate, right? We are not able to prevent that rejection, right? Third is primary disease, right? Now iga suppose there is already hepatitis B, right? Hepatitis C, right? Post idu they can reactivate, right? At the same time autoimmune irutte, autoimmune can reactivate, right? Primary disease is not gone. That can still be there even after the transplant, right? Finally liver cancer, right? So liver cancer ಮಾಡುವಾಗ liver cancer ಚಿಕ್ಕದಿರುವಾಗ ನಾವು transplant ಮಾಡ್ತೀವಿ, right? But post transplant ಇದು recurrence ಬರೋದು chance always is there, right? So it's always this needs to be a conversation we have with the patients. ಈ ಥರ ಬರ್ಬೋದು, right? But there are solutions also, right? But sometimes the solutions unfortunately don't work.
ಓಕೆ. ಸೊ ನೀವು ಡಿಪಾರ್ಟ್ಮೆಂಟ್ HOD ಇನ್ ರಾಮಯ್ಯ. ಸೊ ಇಷ್ಟು ವರ್ಷಗಳ ಜರ್ನಿ ಹೇಗಿತ್ತು?
Journey in gastroenterology has been very eventful. Andre, it has been about more than 10 years, right?
Yeah.
Idaralli, right? And we have the field of gastroenterology has seen a huge change, right? ನಾನು ಯಾವಾಗ ನಂದು DM ಮಾಡ್ತಾ ಇದ್ದೀನಿ and what we practice now, right, is actually different, right? We don't usually see that. Andre, usually ನಾವು ಏನು ಓದಿದೀವೋ, right, the same thing we practice for most of our life. Only the last part will things change, right? Adre gastroenterology is developed at a huge pace,
Okay.
right? So the number of procedures that we do were not being done 10 years back, right? Now we are doing it commonly, okay, right? The medications nan held hepatitis C do, right? It has come and completely changed the way we treat, right? So as a field, it is a very exciting field and it has changed a lot, but at the same time it's been challenging, right? So I'm also a professor. So
Yes.
nano classes, I have students under me, right? So that becomes challenging. Yakandre iga I not only do I have to look at what is the basics, right? I have to start teaching them what is happening in the last few months even, right? So that is, you have to keep updating yourself, right? You have to go to conferences and CMEs to get what is the current opinions, right? So adu tumba agide in gastroenterology, right? So it is challenging, but at the same time very fulfilling, right? We've reached a point where endoscopically now tumors tegibodu, right? Endoscopically we are doing almost surgeries, right? We are doing through endoscope, right? So it is exciting and it is challenging, but I think gastroenterology is a field for the future.
Well, not only for gastroenterologist, I'm asking behalf of all doctors. Doctor ಕೆಲಸ ಎಷ್ಟು ಕಷ್ಟ?
Yes, it is. ನಾನು frank ಆಗಿ ಹೇಳ್ತೀನಿ, it is difficult.
Yeah.
Okay, right? It is not easy to balance your work and life and your personal life, right? ಯಾಕಂದ್ರೆ ಡಾಕ್ಟರ್ ಕೆಲಸ ಅಂದ್ರೆ ಯು ಹ್ಯಾವ್ ಟು ಬಿ ಇನ್ ದ ಹಾಸ್ಪಿಟಲ್.
Yes.
ಈಗ ವರ್ಕ್ ಫ್ರಮ್ ಹೋಮ್ ಮಾಡೋಕ್ಕಾಗಲ್ಲ ನನಗೆ, ರೈಟ್? ಐ ಹ್ಯಾವ್ ಟು ಬಿ ದೇರ್, ಐ ಹ್ಯಾವ್ ಟು ಸಿ ದ ಪೇಷಂಟ್, ರೈಟ್? At the same time, we have a responsibility to the patient, right? We are dealing with lives, right? So the stakes are very high, right? So ಆ ಥರ ಇರುವಾಗ it is a stressful atmosphere, right? ಆದರೆ ಡೇ ಟು ಡೇ ನೋಡುವಾಗ we don't feel it as much, okay, right? Because for us, we are used to it, right? If you look at my journey from a medical student, right, at no point I have thought, oh, nanga agala idu.
Yes,
right?
I can do
it. It has never happened. It has been difficult, but it has never been I can't do it, right? So if there are kids who are looking at doctor as a profession, right, I would say it is deeply rewarding. It is stressful and difficult, but it is one of the most rewarding professions that you can do.
ಯಾಕೆ
right?
ಗ್ಯಾಸ್ಟ್ರಾ? Yes.
Yeah. And over a period of time, the stress comes down, right? Over a period of time, work-life balance ನೀವು achieve ಆಗುತ್ತೆ, but it's only much later.
Okay.
Okay, right?
ನಿಮ್ಮ ಪ್ರೊಫೆಷನ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದಾಗ ಗ್ಯಾಸ್ಟ್ರೋಎಂಟರಾಲಜಿಸ್ಟ್ ಆದ ಮೇಲೆ ಸೊ ಎಷ್ಟು ವರ್ಷ ನಿಮಗೆ ತುಂಬ ಕಷ್ಟ ಇದೆ ಅಂತ ಅನ್ನಿಸ್ತಿತ್ತು?
Not a single day. It's not a single day because ಇದು so MBBS to 5.5 years, right? MD to 3 years, and then DM another 3 years. ನಾನು fellowship ಮಾಡಿದೆ another 1 year, right? So that is 13 years of study, right?
Okay.
So by that time, ನಮಗೆ already we are in the grind. We are used to long working hours, right? We are used to sleepless nights, right?
Yes.
So it's not, for me, staying awake is not the problem, right? Adre I'll tell you the only thing that I find stressful, right? I find stressful when I'm seeing a patient in the endoscopy area who's had a complication, but I don't have a scope in my hand. Okay, right? If I have the scope in my hand, I'm okay. And I'm 100% certain that I will be able to do something and help the patient out, right? Scope ildaga, that is when my heart rate goes up, right? I've noticed it. ನಾನು ಬಿಫೋರ್ ದ ಪ್ರೊಸೀಜರ್ ಮೈ ಹಾರ್ಟ್ ರೇಟ್ ವಿಲ್ ಬಿ ಅ certain level, right? ಪ್ರೊಸೀಜರ್ ಆದಮೇಲೆ when the scope is inside, my heart rate comes down, right?
Okay.
Because that is familiar, right? Because that I know I can do something, I can, whatever happens, I have the scope in my hand, right? So ಆ ಥರ ಬಂದಿದೆ ಈಗ. So at no point have I felt that ಇದು ತುಂಬ ಕಷ್ಟ ಇದೆ, I can't do it.
ಕಮಿಂಗ್ ಜನ್ರೇಷನಲ್ಲಿ ಪೇಷಂಟ್ಸ್ ಅನ್ನೋದು ತುಂಬ ಕಮ್ಮಿ ಆಗ್ತಿದೆ ಅಂತ ಸ್ಟಡೀಸ್ ಹೇಳ್ತಿದೆ. ಜನ ಹೇಳ್ತಿಲ್ಲ, ಸ್ಟಡೀಸ್ ಹೇಳ್ತಿದೆ. ಸೊ ಫ್ಯೂಚರ್ ಗ್ಯಾಸ್ಟ್ರೋಎಂಟರಾಲಜಿಸ್ಟ್ಗೆ ಏನು ಹೇಳ್ತೀರಿ? ವಾಟ್ ವಿಲ್ ಬಿ ಯುವರ್ ಅಡ್ವೈಸ್?
For in terms of gastroenterology, andre
Yeah,
if
in
you want
terms
to
of all,
pursue
yeah.
medicine, right?
Yes.
The way we practice medicine is changing, okay, right? And I think for the next generation, they have a lot of source of information because we are in the knowledge age, right? We are in the information age, right? Because with the internet, with AI coming in, right? They have a lot of sources of information, okay, right? ಕೆಲವು ಸಲ ದ ಚಾಲೆಂಜಿಂಗ್ ಪಾರ್ಟ್ ಇಸ್ ನಾಟ್ ಅಬೌಟ್ ಲ್ಯಾಕ್ ಆಫ್ ಇನ್ಫಾರ್ಮೇಷನ್. ನಮಗೆ ಥೀಸಿಸ್ ಮಾಡಬೇಕಂದ್ರೆ ನಾವು ಲೈಬ್ರರಿ ಹೋಗ್ಬಿಟ್ಟು ಬುಕ್ಸ್ ತೊಗೊಂಡು ವಿ ಹ್ಯಾವ್ ಟು ರೀಡ್ ಇಟ್ ಆ್ಯಂಡ್ ದೆನ್ ಗೋ ಥ್ರೂ ಇಟ್ ಆ್ಯಂಡ್ ದೆನ್ ಮೇಕ್ ನೋಟ್ಸ್ ಆ್ಯಂಡ್ ದೆನ್ ರೈಟ್ ಇಟ್. ಈಗ ದ ಹೋಲ್ ಥಿಂಗ್ ಕ್ಯಾನ್ ಬಿ ಡನ್ ಆನ್ ಯುವರ್ ಫೋನ್, ಓಕೆ, ರೈಟ್? ಸೊ with such ease of information, right, it becomes very easy to get carried away, right? It becomes very easy to adopt the wrong information also, right? So the advice that I would give students is, although the way we practice medicine is changing, right, core tenets ಇದೆ, it is a profession which will always be there. ತುಂಬ ಇದು ಹೇಳ್ತಾ ಇದ್ದಾರೆ, the AI people are saying, you know, medical profession will not be there in a few years.
No,
ಅಂತ,
yes,
right?
yeah.
It is not true, right? It is my belief that AI, ನಾನು ತುಂಬ, I've worked in AI, by the way. My area of research is AI, okay, right? And AI will always remain an assistant. It will always remain a tool for you to use, okay, right? ಯಾಕಂದ್ರೆ ಅದು ಹ್ಯೂಮನ್ ಆಸ್ಪೆಕ್ಟ್ ವಿಲ್ ನೆವರ್ ಕಮ್ ಇನ್ ಎ ಐ. ಎ ಐ ಇಸ್ ಅಲ್ಗಾರಿದಮ್ ಬೇಸ್ಡ್, ಇದಿದೆ, ರೈಟ್? ಬಟ್ ದಟ್ ಹ್ಯೂಮನ್, ದಟ್ ಸಮ್ಟೈಮ್ಸ್ ದರ್ ಇಸ್ ಅನ್ ಇಂಟ್ಯೂಷನ್. ಕೆಲವು ಸಲ ನಾನು ಪೇಷಂಟ್ ನೋಡುವಾಗ, even though the guidelines say something, right, I see the patient as a whole and there is something in me that doesn't sit right. And ನಾನು ಹೇಳ್ತೀನಿ, ಏನೋ ಇದೆ, we'll have to do something, we'll have to approach this differently, right? ಅದು ಬರಲ್ಲ AI, right? So that individual treatment is not something that AI can do, right? At least not now, at least not for the foreseeable future, okay, right? Maybe down the line, who knows, nothing is set in stone, right? But at the same time, I think for the younger generation, the way we practice medicine is different. We have to approach it differently, but I think medicine is here to stay, right? You will always, it is the most noblest of professions, right? And the most impactful for society is medicine, okay, right? I'll tell you, one question I'll ask you. When do you think civilization started? Andre, prehistoric ನಾನು ಹೇಳ್ತಾ ಇರೋದು, when Stone Age, right? ಆವಾಗ, right? When do you think scientists say, ಈ period in the, it is civilized?
Themselves they are civilized actually.
Yeah.
Themselves
When the
they are
civilization-
scientists. Yeah.
Yes. So when do you think civilization started from prehistoric? I'll give you an option. When they started cultivating agriculture. That's one option, right? Second is when they started building cities and towns. Okay, right? Or third is when they started treating people.
Third one, treating people.
It is treating people.
Yes.
Okay, right? So the first time civilization started was when they saw a bone and it was broken and healed.
Yes.
Okay, right? Where they put something. That means someone stayed with that person who had broken his bone, right? And took care of him or her, right? So that they don't get eaten by other pranigalu. Okay, right? So that is the community. That is the earliest evidence of it. And that is much, much before we started cultivating agriculture, right? So healthcare started at that time, right? So healthcare started at that time and it will be there till humanity exists, in my opinion, right? So if you are interested, it is hard but challenging but extremely rewarding.
Do you watch movies?
Of course.
Which is your favorite?
Favorite movie, my all-time favorite is Dark Knight.
Okay.
The Batman movie.
ಮ್ಯೂಸಿಕ್ ಕೇಳ್ತೀರಾ?
Of course.
ನಿಮ್ಗೆ ಯಾರಾದರೂ ಅರ್ಜಿತ್ ಸಿಂಗ್ ಥರ ಕಾಣ್ತೀರಿ ಅಂತ ಹೇಳ್ತಾರಾ? ಅರ್ಜಿತ್ ಸಿಂಗ್.
Lot of times.
ಲಾಟ್ ಆಫ್ ಟೈಮ್ಸ್.
Yes. ತುಂಬ ಹೇಳ್ತಾರೆ.
ನಾನು ಆ್ಯಕ್ಚುಲಿ ಇಂಟರ್ವ್ಯೂ ಸ್ಟಾರ್ಟ್ ಆದಾಗ್ಲೇ ಹೇಳೋಣ ಅಂದ್ಕೊಂಡಿದ್ದೆ, ಬಟ್ ಬೇಡ, ಇಟ್ಸ್ ಗೋಯಿಂಗ್ ವೆರಿ ಸ್ಟ್ರಿಕ್ಟ್ಲಿ ಆಮೇಲೆ ಹೇಳೋಣ ಅಂತ ಅಂದ್ಕೊಂಡೆ. ಏನು ಅನಿಸುತ್ತೆ ಹಂಗೆ ಹೇಳಿದಾಗ?
It's good.
ಎನಿ ಸ್ಟೂಡೆಂಟ್?
Any student ಅಂದರೆ
ಇದನ್ನ ಹೇಳುವಂಥವ್ರು? ಮೆನಿ ಸ್ಟೂಡೆಂಟ್ಸ್.
Many of them have told me about this.
ಓಕೆ.
ಇನ್ನೊಬ್ರು ಕನ್ನಡ ಆಕ್ಟರ್ಸ್ ಹೇಳ್ತಾರೆ, ರೀಸೆಂಟ್ಲಿ ದೇರ್ ಆರ್ ಅ ಲಾಟ್ ಆಫ್ ಪೀಪಲ್ ಹು ಹ್ಯಾವ್ ಟೋಲ್ಡ್ ಮಿ ದಿಸ್. ರಕ್ಷಿತ್ ಶೆಟ್ಟಿ. ಸೊ ಅವರು ಲುಕ್ಸ್ ಲೈಕ್ ರಕ್ಷಿತ್ ಶೆಟ್ಟಿ ಅಂತ ಹೇಳ್ತಾರೆ. ತುಂಬಾ ಐ ಫೀಲ್ ವೆರಿ ಹ್ಯಾಪಿ. ಸೆಲೆಬ್ರಿಟಿ ಅಂತ ಕಾಣಿಸ್ತಾ ಇದ್ದೀರಾ ಅಂದ್ರೆ ಇಟ್ ಇಸ್ ಸಮಥಿಂಗ್.
ಯು ಆರ್ ಸೆಲೆಬ್ರಿಟಿ. ಯು ಸೇವ್ಡ್ ಮೆನಿ ಲೈವ್ಸ್.
ಥ್ಯಾಂಕ್ ಯು
ಆ್ಯಕ್ಚುಲಿ. ಆ್ಯಂಡ್ ನೀವು ತುಂಬ ಬೋರ್ ಆದಾಗ ಅಥವಾ ತುಂಬ ಸ್ಟ್ರೆಸ್ಫುಲ್ ಅನಿಸಿದಾಗ ಏನು ಮಾಡ್ತೀರಾ?
ಲೆಗೋ ಆಡ್ತೀನಿ.
ಲೆಗೋ ಆಡ್ತೀರಿ. ಓಕೆ.
I have my own Lego set, right?
Okay.
So that is something of a passion for me, right?
Okay.
So Lego sets it martini, that is my way of thinking, that is my way of de-stressing also.
ಓಕೆ. ಸೊ ನೀವು ಸ್ಟೂಡೆಂಟ್ ಆಗಿದ್ದಾಗ ಈ AI ಆಗಿರ್ಬೋದು ಅಥವಾ ಈ ಫೆಸಿಲಿಟೀಸ್ ಅವಾಗಿದ್ದಾಗ ಏನೆಲ್ಲ ಮಾಡ್ತಿದ್ರಿ?
ಈ ಫೆಸಿಲಿಟೀಸ್ ಇದ್ದರೆ I would have probably cheated on a lot of my exams. I'm just joking.
ಓಕೆ.
I'm just joking. But I think Nandu research output would have been much more if this was the case, right? Using AI to plan even your daily activities, planning trips, right, is something that I find fascinating, right? Now MBBS Madvaga, I did my MBBS from Manipal, right? And although Manipal has a very party school anta ಹೇಳ್ತಾರೆ,
Yes.
right? But it was if you want to party you could have partied, but if
Yes.
you want to
Study,
it
yes.
was one of the best colleges to study to, right? Now trip ಮಾಡುವಾಗ it used to be with maps, right?
Yes.
ಅಂದ್ರೆ physical maps,
ಇಲ್ಲಿಂದ
right?
ಇಲ್ಲಿವರೆಗೂ.
there was no phone, there was no Google Maps,
Yes.
right? So we had to kind of like figure out ಎಲ್ಲಿ ಹೋಗ್ಬೇಕು ಅಂದ್ರೆ ಇಲ್ಲಿ I'm talking about day trips or wherever we go. We used to do it with maps, okay, right? So there was no access to technology the way it is now, right? So I think in terms of the kind of activities, in terms of the quantum of fun, it would have been the same. It would have been slightly different, but the amount would be the same, right? The number of days I have missed college will probably be the same because you can't miss any more college than I missed. Okay. so
This
so
is for your
this
students.
yes. So I tell my students, like,
Okay.
you know, it's not, attendance is not a measure of how good of a doctor you're going to be, right? Attendance is never a measure of that, okay, right? It is about what you do with the tools you have when you get it, right? So in college you have to study. It's not that I'm not saying you don't study, right? You do what you have to do, right? But getting 98% attendance or 100% attendance doesn't guarantee you that you're going to be a good doctor, okay, right? Even people who have 50% attendance, 60% attendance can become a professor and HOD of gastroenterology. Okay, right?
Skills
So,
matters.
Skills matters. What you do later matters.
Yes.
Right?
Even in medical field.
Absolutely. Right?
Okay.
Even in medical field. That doesn't say that I'm not condoning people to not attend class, right? I'm saying that if you miss one or two classes, right, you can easily make it up.
Yes,
Right?
true.
And it is what you do later that counts. Okay, right? So I'm a living example of that.
ಓಕೆ. ನೀವು ಹಾಡು ಹಾಡ್ತೀರಾ?
I dabble in, andre it's not like training ಏನು ಸಿಕ್ಕಿಲ್ಲ, but I have sung for my college bands
Can
ಎಲ್ಲ
you
ಇದೆಲ್ಲ.
sing for me?
Oh no I can't. Not now, no, sorry, no.
Then when?
In a different setting maybe, definitely.
ಡಿಫ್ರೆಂಟ್ ಸೆಟ್ಟಿಂಗ್.
Yes,
ಓಕೆ.
sure.
ಸೊ ನನ್ನ ಕ್ಯಾಮ್ರಾ ಲೈಟ್ಸ್ ಕಲರ್ ಚೇಂಜ್ ಮಾಡಲಾ? ಓಕೆ.
But some other day, definitely.
ರೀಸೆಂಟ್ಲಿ ಯಾವ ಮೂವಿ ನೋಡಿದ್ರಿ?
Recently ನೋಡಿದ್ದು was Moana 2, because I have two small children, right? So
okay.
ಈಗ ನಾವು ಮೂವಿ ನೋಡೋದು strictly animated movies. I've not watched any other.
ಓಕೆ.
Right.
ಹೂಸ್ ಯುವರ್ ಫೇವ್ರೆಟ್ ಪರ್ಸನ್ ಇನ್ ಯುವರ್ ಲೈಫ್?
Favorite person in my life?
ಯಾ.
It has to be my wife, right? And that's I think she's been a pillar of support for me, right? And I think going forward also she's the reason why I've reached where I've reached.
What's
So
her name?
definitely. It's Ashwini.
Ashwini. I'll ask you 3 questions.
Okay.
Okay. What is her favorite food?
She is a vegetarian who hates vegetables.
Really? Then
Yes.
what she eat?
She eats paneer. She loves paneer.
Okay.
Yeah. So her favorite food is paneer, especially paneer burji that she makes.
Okay.
Right? She loves that.
Okay. One more question, open-heartedly. What do you wanted to say her through this podcast?
No, I think I would like to thank her for all the support that she's given, right? And I would like to express the fact that I think without her being able to handle all the other aspects of our life in such a good way, right? I don't think I would have reached any position of authority, right? Or any position for that matter, right? So most of the credit for where I go, where I am, right, will be to her and of course my parents, but she has been a pillar of support for me in the last 10 years.
Nim love marriage, arranged marriage?
It was arranged introduction. Yeah.
Arranged introduction. Okay.
Yeah.
So open-heartedly, what do you wanted to say your staff, Ramaiah?
I think we are in a department that is on the rise, right? We are on the in the last few years we have seen the kind of work that we're doing is very, very complex, and it is on par with most institutes in the world, right? So my staff has been a key reason for that, right? They work tirelessly, they never complain, right? And they always look at patient-centric care, I'll tell you that, right? And endoscopy technicians, nurses, right? Their first priority is
Patients.
is okay or not,
Yes.
right? Everything comes afterwards, right? Tumba sala we get lost in the nitty-gritties of the billing paperwork documentation correct agidya illa,
Fees
right?
cut, bidi.
But yes, we lose that sight of how important the patient is, okay, right? But my staff is not like that. I'm proud of my staff and I stand by them. I think the department is on the threshold for something of an expansion, and I feel like we can do some good work in the years to come.
Okay, many students are watching you. Open-heartedly, your message for them.
Stay true to yourself. Be okay. Have the courage to be happy. Have the courage to be disliked also.
Okay.
Right? Because in this social media age, right, we get caught up with likes and trolls on the social media, right? Which reduces their self-esteem, right? They want to be seen as people who have substance. They want to be seen as people who are loved, right? And I think that should change,
Okay.
right? I think one message that I would have, two messages. One would be have the courage to be disliked. There is a beautiful book called Courage to be Disliked. It is on Adler's philosophy, and I feel every student should read that. The second book that I feel every student should read is Mindset. Okay, right, by Carol Dweck. Mindset is a book which prioritizes learning rather than achievement. Andre, when you look at a kid and you say you are very intelligent, the kid now has a label attached to him that is intelligent. So the next time ಏನಾದರೂ challenging ಬಂದ್ರೆ he or she feels that ನಾನು intelligent ಇದ್ದೀನಿ, I should be able to solve it. ಆದರೆ once he starts finding it difficult, they give up. Because they don't want to lose that intelligent time. Okay, right? Now ಮಾಡಿ ನಾನು fail ಆಗೋದು ಬದಲ we'll just give up. That should not be there,
Yes.
right? So the importance should be placed on learning rather than achievement and labels. Okay, right? So these are the two books that I feel all children or kids should read at some point in their life. I read a lot, right? So my most gifted article is a book. I gift everyone a book. Okay, right? So I think that is very important.
Book is your friend.
Book is definitely one of the best friends I have.
Oh,
right?
very nice.
When I was when we were pregnant for the first time, right? Now baby shower ಗೆ normally ನಾವು baby shower ಗೆ ಎಲ್ಲ ಫ್ರೆಂಡ್ಸ್ ಕರ್ತೀವಿ, right? And then they will give something that you
Gifts,
can
yeah.
use during this one. ನಾನು ಹೇಳಿದೆ we don't want anything, we have everything, right?
I want books.
I want a book. One book that you want my child to read at some point. Your favorite book that you would want the child to
How
read.
old they are?
Right? My older child is 7, younger child is 4.
Are they reading book?
They are already reading.
Okay.
Right? And they have their own library because of this.
Wow.
All my friends sent books, even though they
Very
couldn't come,
nice.
they've sent the books.
Okay.
So I'm building a library for them. One wall is only books.
Oh, very nice. Okay, so we spoke about one H, that is hepatitis, but I wanted to ask you about two H's, that is one happy and health. ಓಕೆ ಸೊ ಹ್ಯಾಪಿ ಮತ್ತು ಹೆಲ್ದಿ ಲೈಫ್ ಲೀಡ್ ಮಾಡೋದಕ್ಕೆ ಏನು ಅಡ್ವೈಸ್ ಕೊಡ್ತೀರಿ? ದಿಸ್ ಈಸ್ ಮೈ ಲಾಸ್ಟ್ ಕ್ವೆಶನ್.
To lead a happy and healthy life, you need to be at peace with yourself, right? And you need to be able to have purpose in your life. Okay, right? When you have a purpose in life, everything falls into place, right? And it doesn't have to be purpose to change the world, right? That starts first with yourself and with the people who are immediately with you, right? Mother Teresa was asked this question, right? How would you change the world? Her answer was, go home and love your family, right? You will change the world, right? By just doing that, which means what she was trying to say is it starts with the people around you.
Family.
Okay, right? So having the right kind of people around you, right? Having the right kind of mindset, okay, right? And having purpose in life, right, will give you peace and will give you happiness.
ಓಕೆ,
Right? So that is my message.
ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಡಾಕ್ಟರ್ ಹರ್ಷವರ್ಧನ್.
Thank you.
ಇಷ್ಟೊತ್ತು ಇದ್ದು ಸಾಕಷ್ಟು ವಿಷಯನ ತಿಳಿಸ್ಕೊಟ್ರಿ. ಸೊ ಆ್ಯಸ್ ಐ ಟೋಲ್ಡ್ ಅರ್ಲಿಯರ್, ದಿಸ್ ಈಸ್ ಓಪನ್ ಹಾರ್ಟ್ ವಿತ್ ಸಬಾ ಪ್ರೋಗ್ರಾಮ್.
Yes,
ಇಟ್ಸ್ ನಾಟ್ ಓನ್ಲಿ ಡಿಸ್ಕಸಿಂಗ್ ದ ಒಂದು ಡಿಸೀಸ್ ಬಗ್ಗೆ ಡಿಸ್ಕಸ್ ಮಾಡೋ ಪ್ಲ್ಯಾಟ್ಫಾರ್ಮ್ ಅಷ್ಟೇ ಅಲ್ಲ, ದಿಸ್ ಇಸ್ ಅ ಪ್ಲ್ಯಾಟ್ಫಾರ್ಮ್ ಫಾರ್ ಲೈಫ್, ಸ್ಟೂಡೆಂಟ್ಸ್ ಆ್ಯಂಡ್ ಎವ್ರಿಥಿಂಗ್. ಸೊ ತುಂಬ ಜನರಿಗೆ ನಿಮ್ಮ ಎಲ್ಲ ಮೆಸೇಜ್ ರೀಚ್ ಆಗುತ್ತೆ ಅಂತ ನಾನು ಅಂದ್ಕೊಂಡಿದ್ದೀನಿ. ಥ್ಯಾಂಕ್ ಯು ಫಾರ್ ಜಾಯ್ನಿಂಗ್ ಅಸ್.
Thank you so much for the invitation. This interaction was very a lot of fun.
ಥ್ಯಾಂಕ್ ಯು.
Thank you.
ಬಟ್ ನೀವು ಹಾಡು ಆಡಿಲ್ಲ, ಬಾಕಿ ಇದೆ, ನೆಕ್ಸ್ಟ್ ಟೈಮ್
Next
ಮಾಡಿಸ್ತೀನಿ.
time ಮಾಡೋಣ.
ಓಕೆ, ಸೆಟಪ್ ಚೇಂಜ್ ಮಾಡಿಸ್ತೀನಿ.
Yes.
ಯಾವ ಕಲರ್ ಇಷ್ಟ ನಿಮಗೆ? ವಿಚ್ ಕಲರ್ ಯು ಲೈಕ್ ದ ಮೋಸ್ಟ್? ಆರ್ ಎಲ್ಸ್ ಆ್ಯಕ್ಚುಲಿ ಐ ಆಮ್ ಪ್ಲಾನಿಂಗ್ ಫಾರ್ ದ ಲೈಬ್ರರಿ ಸೆಟಪ್.
Yes.
ಸೊ ಅಲ್ಲೇ
Definitely. If you do a library setup, 100% I will sing. Deal.
ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್.
Thank you.
ವೆಲ್, ಡಾಕ್ಟರ್ ಪ್ಲಸ್ ಲಿವರ್ ಹೇಗಿರುತ್ತೆ ಕಾಂಬಿನೇಷನ್, ಮತ್ತು ನೀವು ಇದನ್ನು ಎಷ್ಟು ಸೀರಿಯಸ್ ಆಗಿ ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕು ಅಂತ ಈ ಪಾಡ್ಕಾಸ್ಟಿಂದ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಅರ್ಥ ಆಗಿದೆ ಅಂತ ಅಂದ್ಕೊಂಡು ಓಪನ್ ಹಾರ್ಟ್ ವಿತ್ ಸಭಾ ಕಾರ್ಯಕ್ರಮವನ್ನು ಮುಗಿಸ್ತಾ ಇದ್ದೀನಿ. ನೆಕ್ಸ್ಟ್ ಎಪಿಸೋಡ್ನಲ್ಲಿ ನೆಕ್ಸ್ಟ್ ಗೆಸ್ಟ್ ಯಾರು ಬೇಕು ಅಂತ ಕಮೆಂಟ್ ಮಾಡಿ, ನಾನು ಹೋಗಿ ಬರ್ತೀನಿ. ನಮಸ್ಕಾರ.